Call this meeting to order. Please stand for the Pledge of Allegiance. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call, Jill.
Frank Carini.
Here.
Cheryl Cerniglia.
Here.
Amy Millette.
Here.
Leah Schreiber Johnson.
Here.
Mark Verhalen.
Here.
Darren Grabowski.
Here.
Jane Eichhoff.
Here.
Good evening, everyone. Thank you for attending our Board of Education special meeting here on September 8th. Right on the agenda, number 4 is our public input. We're going to recess formal portion of the meeting to entertain comments or questions on the agenda items. There is a yellow form that you need to fill out, and I will turn it over to Superintendent Dan.
So, Mr. Technology over there at the NGC, do we have speakers? And if so, you can begin to bring them up. Mr. Cromie will be timekeeper for this portion of the meeting, 30 minutes total, 3 minutes a person, and we'll try to hear from as many people as we can.
All right, we got 1 public comment and 3 more in line.
Okay, sounds good.
Go ahead. Good evening, Jerry Chris, 1020 West Dover Drive. Thank you for the opportunity to address the board this evening. I understand the board is not able to answer questions from citizens at these meetings. I totally understand that. I'm sure tonight's meeting is going to have a presentation from Superintendent Earl. What I would just like to do is, I'm sure you guys have great questions to ask after this, but I'd like to go ahead and suggest some other questions. The first question I'd like to have you guys address to the superintendent after his presentation is why are we looking at the 14-day disease burden? Why is it so important? Why are we not looking at active daily cases? Active daily cases gives us an indication of how many people here in Oak Creek are walking around with this. In doing some quick math, on our highest day here in Oak Creek, we've only had 0.578% of active cases. It's just a question that I'd love to hear asked, and why, especially to the health department, if they're here tonight. Why is the disease burden so important? Where are we at with staffing? That's the next question. Are we staffed up? What's the substitute pool look like? This should be something that's on the dashboard for us to see. If it's important that it's going to keep the kids out of school, if our staffing is low, I'd like to have some information on that. Have we looked at other districts around the country that have gone back to school? Are there success stories? Are there horror stories? Where are we at with that? What kind of research are we doing in other districts? What kind of feedback are we getting from parents? I'm seeing a lot of stuff online that kids are just devastated, that they are having so much trouble with online learning. There's tears, there's drama constantly. Where are we at with this? What are we providing these parents for support? What are we providing the kids? Where are we at with essential services? How does a high school kid get to talk to their guidance counselor for college prep? Where are we at for 5th graders and 8th graders for planning for their next step? So those are questions I have. And the big one is, when is this going to end? When are we finally just going to say, enough, we got to figure out how to get these kids back in school? I got 11 seconds left. I appreciate the job you're doing. I understand it's stressful, and I thank you for your time. Okay. You have 3 minutes. Yep. Facing the camera, you have 3 minutes starting now.
Hi, Mike Dudzik, 1350 West Daniel Lane, Oak Creek. My question is, I don't understand why we're using positive test as the criteria and metrics for making this decision. And I would hope that you could address that for me tonight. Because when we drill down, we have data or availability from the health department, both Wisconsin and locally, that children, as far as hospitalization, there's only been 2 over the last 6 months, 0 ICU cases, 0 deaths, and to the best of my knowledge, there's no evidence that kids are spreaders or super spreaders. So I don't understand why we're not using those categories as far as the metrics rather than the positive tests. To me, it seems like we should drill down to the next step or the cases that I just mentioned, because it would seem that the positive tests would drill down to those anyway, so that's what we should use. So I'd appreciate it if you would address that today. Thank you.
Yep, right in there, and 3 minutes, Mike. Okay. Hey everyone, my name is Tony Gallo. I live off of Shepherd in Oak Creek here. My son's in 1st grade. You guys might recognize me now. Over the past couple of weeks, I've had the opportunity to email with a number of you, speak with you, Frank and Dan, on the phone a couple of times. So the first thing I wanted to say was that I appreciate the board being very accessible, open to communication, being very responsive. I had a really long email out to you guys after the first meeting that we had, and I was pretty delighted to get responses from just about all of you. So I do appreciate that. I'm sure you're getting lambasted by everybody during this. So give credit where credit is due. To sort of echo what some of the other people have already said, the data doesn't support the decisions that you guys are making, the recommendations from the health department. I maintain that the metrics that are being used to make these decisions should be looked at under extreme scrutiny to determine how, those metrics actually correlate to safety in the schools, to spreading in the community, to danger for teachers. The research that we do have available seems to point in the opposite direction. The research and recommendations that we have from officials in our country and from all over the world seem to indicate that keeping the kids out of the school environment and keeping them locked in their houses or in these day programs is extremely detrimental to their mental health, to their physical health. Things like substance abuse, unfortunately child abuse, suicide, these are real issues that are hurting our kids and killing them every day across the country and doing far more damage than COVID ever will. The numbers are already starting to prove that out. So in our community, where the spread has always been relatively low, the numbers have never been very high. Certainly hospitalizations and deaths in the lower age brackets, but really in the population as a whole have been very low. I'm just urging the board, again, like I did in the first meeting, to please reconsider your decisions. I don't know what's possible in the politics with the board meeting tonight, but if it's possible to push for some sort of a vote, some sort of a measure to go back and reverse that decision, try to move in the right direction and get these kids back in class, the community would support that. And I think the survey that you sent out earlier this summer would pretty much proves that. That's it. Thank you. Okay, you have 3 minutes. Why don't you start? Just right about there.
Okay. Good. Ladies and gentlemen of the school board, thank you for hearing me. My name is Ben Matson. I live on 615 East Parkway Estates Drive. I have 3 boys in the school system, 2 in high school, 1 in elementary. I just wanted to go over, Mr. Carini stated last time that he was a numbers man. I also enjoy numbers. As I see it now, going off the Oak Creek Health Department COVID dashboard, here are some real numbers. As of 2018, there are 36,470 people in the city of Oak Creek. As of September 4th, there are 7,470 tests that were administered. That's only 20% of the population of Oak Creek. That's 1/5. Of those cases, 720 were positive. That is 2% of the entire population of Oak Creek. Of those 720, 665 have recovered. That's 92.4% of the cases that have tested positive. Of those cases, 112, I added the 76 that were hospitalized and the 36 that are active. That is 0.3% of the Oak Creek population. 19 deaths is 0.05 or 0.05%. August 30th, the CDC released new data showing that 6% of reported COVID deaths were only COVID related. That means 94% of those other cases had 2.6 other pre-existing health conditions and contributing causes, including flu and pneumonia, respiratory failure, hypertensive disease, diabetes, vascular and unspecified dementia, cardiac arrest, heart failure, renal failure, and other medical conditions. I would urge you to take this into consideration as we need to open the schools back up for the kids and for the teachers that want to go back to work. Thank you for your time.
Okay, right around here, 3 minutes when I get started.
Hello, board. Thank you for taking time to speak with us here today and hear what we have to say. My name is Josh Bretzlup. I've got 2 kids in elementary school, a 3rd grader and a 5th grader. Heard a couple speakers talk about this already. Again, I think they're right on the money. I am a safety director of a large utility construction company. I manage about 1,200 employees with that. And a couple things that we're looking at here where I work, again, focusing on hospitalization rates, death rates, I think is a step in the right direction versus looking at the burden rates and the percent positivity rates where we're currently facing here today. Also, just again, making sure that our essential workers are out there. We've been dealing with all the issues facing COVID for the last 6 months. We found a way to make it work. Other careers, other jobs that individuals have here today have been making it work in the ever-changing environment. It's okay for us to change decisions as long as we're focusing in the right direction here. Again, understanding that our kids need to be back in school. We need to create a plan to get them back there. As we know, things are going to change throughout the whole pandemic as they have been, and we need to find a way to get them back in the classroom. I know we started out with online learning. I can tell you from what I've seen so far, I think my daughter has maybe had about an hour and 45 minutes of actual online schooling with a teacher. That's not going to cut it. We have already seen a big slide, in my opinion, from where the kids stopped going into in school versus where they are now. I've actually heard from other parents who have had 1st graders, now 2nd graders, who some of their kids are even having a hard time remembering basic letters of the alphabet. And I think a lot of that is due to not having the in-person learning. We've got to get them back for the socialization that they have within their schools and you know, with all their friends as they're out there. And again, we need to come up with a plan to actually keep the kids in school. That's all I got for you today. Thank you.
Yeah. Right around there, 3 minutes when I get start. Okay.
Hi, my name is Dan Peck. My son goes to the high school here. I guess I got be very blunt. Greendale's open, Franklin's open, Martin Luther's open. Why aren't we? What are they doing that you're not doing? I'm not here to be nice about things. I'm just trying to be to the point. We should be open like they are. Are they better at doing things that you guys are not? What are we missing here? Okay. You got the referendum's passed. You got all this work being done in schools, and no one can go into schools. It's like owning a home and no one can live in it, and you're paying the mortgage. This is silly. Okay. When the tax bills come in December, everyone's be mad. Why? Because they're paying for stuff and the kids can't even use it. We got to get up to speed here now, because this is making us look bad. If these other communities can do this stuff, why can't we? Okay. First and foremost, I'm just going to be honest here. If teachers don't want to teach, then they have, for instance, on their line of work. If they're afraid, I understand it. I wouldn't go to a job if I was afraid. I would find a new job. You just can't say I don't want to teach in front of kids. And I'll leave you on this. In America, and even throughout Europe, there is not one case where a child has got a teacher sick. Now remember, I just said to everybody, where's that case? That means we should be open right now. This is just ridiculous. Plain and simple. Tell me the case where teachers got sick from a student. They don't exist. This is ridiculous. Let's move forward, open this up now. The kids are being upset. They're upset. They need to get back to their friends and socialize. Like I said, the rest of these communities are doing what they're supposed to be doing, close by. We are not. We're looking bad. Let's get up to speed, please. Thank you.
All right, 3 minutes when I hit start.
Hi, my name is Jennifer Jones. I would like to start by saying that our children are not political pawns. This is, however, exactly what they're being used for. It all started when epidemiologist Neil Ferguson projected 2.2 million dead people in the United States if no action were taken to slow the coronavirus and blunt its curve. Of course, we cannot get to that death goal without making some drastic reporting changes. So on April 1st, 2020, the World Health Organization changed the reporting guidelines for COVID, unlike any disease in the history of medical coding. They changed it to where COVID can be documented and diagnosed without a confirmed test result. With that, anything that looks like COVID is diagnosed as COVID. Further, COVID is listed as the primary diagnosis regardless of what the patient is being seen for. So if a patient comes in with a sprained ankle and tests positive, COVID gets listed as primary. This has never happened in the history of medical coding. Medical coders are instructed to list signs and symptoms when a diagnosis is not confirmed. But that all changed, and all just for COVID, and all in a good election year. If someone dies of stage 4 cancer, COVID may be listed on their death certificate if they tested positive. When a coroner office determines a positive COVID test, it is listed on the death certificate because they often don't do autopsies for fear of transmission. In addition, facilities are incentivized to diagnose a patient with COVID because the reimbursement rate is much higher for COVID than other diseases. None of that is addressed because the mad scientists in our White House went rogue when he was told to take a back seat. This happened so that the White House could get accurate numbers. Then Dr. Fauci told the state governors to be as strict as possible with their COVID mandates. Once the White House gained control of the COVID numbers being reported, the CDC announced that roughly 6% of cases were listed as death by COVID. Some people already talked about this, so I'm not going to go into that. We already have 50% of the population has T-cell immunity that gives us reactive cells to fight off COVID. I will say that roughly 11,400 cases of the total death count were directly attributed to COVID, but there can also be external causes such as like a car accident or a motorcycle crash. In many cases, that's happened where they're still listed as COVID. So that's included in that 11,400 deaths. I think that COVID-19 will go down as one of the political world's biggest, most shamefully overblown, overhyped, and overly and irrationally inflated and outright deceptively flawed responses to a health matter in American history. The further society drifts from the truth, the more they hate those that speak it. A perfect example is Cheryl asking who Jennifer Jones is on Facebook.
Ma'am, you got 10 seconds.
Right around there. You got 3 minutes when I can start. Good evening, board members. Mario Morel. I was at the last meeting. I have 2 career Oak Creek students. A great career at Carrollton Elementary, West Middle School, and now the high school. I will take a few seconds to regurgitate what I stated at the last meeting. Beyond the fact that this disease has a 99% survival rate, why we're having this conversation to me is mind-boggling. The most important piece is this. Having straight A students at home, both girls straight A students, like many families here in Oak Creek, extremely supportive parents, as some of you board members may know, and parents that are out here today. My wife and I are extremely involved. That being said, after the first week, we get our ALEKS results of their knowledge test. Please take a look at that data in itself. Is the best example as to why they need to be back in school. They have not performed at such a low rate. It's hurtful, and I understand that they have been out of school for 6 months. We have to get these schools open. We've got to get our kids back in there. We have to do all we can to make the right decisions on their behalf and not that of those that don't want to work. I appreciate your time today. Thank you very much.
I have no more speakers at the Ninth Grade Center.
All right, Mr. Bennon, do you have anyone in the Sunshine Room here at District Office?
There are no speakers here tonight.
Okay. Frank, would you like to proceed? Take a short break? What would you like to do?
Everybody good to go? Okay. All right. So we'll go right into action item, potential updates to phase entry and reentry criteria for 2020-21 school year. We have a motion?
So Frank, I could walk us through this report first,
Go ahead.
and I'll note too that that Darcy from the Health Department is here, and I believe she's going to share some additional information with the board, talk through that information, question and answer, and then if there's any motions at that point, we can call for them again. So if nobody minds, I'm going to take us through kind of granularly through the report that was linked to this meeting. Sorry. Yeah, I'll get up and move it. That's fine. I'm sorry, there was a chair obstructing a portion of the screen there. It's out of the way now, so it's okay. All good. So, like I said, we've got a couple of guests here tonight, and I'll note that Assistant Superintendents Thieland and Katarik are here as well in case there's any questions that touch on areas where their expertise could be helpful. So this review of this topic continues the work toward reopening school doors and returning to as close to normal operations as soon as possible, as safely as we can. This is a note that's been on prior reports before. As long as there's COVID that continues to circulate, there continues to be a risk, a degree of risk that some folks have chosen to highlight in their comments to the board, and that those of you here tonight know full well. There will be risk associated with reopening schools until a vaccine or highly effective treatment becomes widely available. Our medical advisor and the health officer, when last they were here, shared a note that I think it's important to reiterate here tonight before we embark upon a review and potential revision. They said it's important to note that we continue to hear this is a novel virus, meaning it's new to clinicians. Folks are learning more about it each passing day. Plans, practices, and recommendations continue to change. Learning is taking place. Reassessing will be necessary and should reflect new learning and should be expected. When we had our last special meeting on August 13th, the board voted unanimously to authorize some criteria that we've worked our way through and to work with the health department and the medical advisor to implement the phased reopening of the Oak Creek Franklin School District. And as you all know, like right now we find ourselves in phase 1, which is a virtual setting. Phase 2 is a hybrid setting, and phase 3 is as close to normal operations as we are, given our new safety measures that we have put in place and shared throughout the summer. We were responding to a spike in cases that are observable in the graphs that are attached that occurred right after the 4th of July holiday. That caused us to have to pause and reassess, meet with some of our community members and talk about this. And that's how we find ourselves where we are this evening. When we were together on August 24th at our last committee meeting, we talked about the draft of the district dashboard that is available on our website and linked here in this report. For folks who are viewing this at a later date, you can open this up and see it there or go to the website. The board specifically discussed back on the 24th percent positivity and how it could be influenced by factors such as interruptions to the amount of testing materials available and a couple of other factors. A few of you spent a few minutes talking about that element. Frank asked me to speak with the health officer, and then we find ourselves here tonight at the special board meeting. If you go to page 2, you see a reiteration of those two binding elements that appear on our dashboard. So if you go to the website and look at the dashboard, you'll see these two pieces broken out in detail. And if you remember from our prior meeting, there's some persuasive elements that are incorporated later in this report. But these are the two key pieces that we've been tracking for a little bit now. That's a summary of burden and a review of percent positivity. When I'm done kind of summing up where we are, Darcy's going to share some more granular elements based on both of these pieces. She's got some handouts to distribute, and I'm sure she'll take some questions. And I asked her to anticipate a few particular points that I've heard from a couple of you along the way. So we'll come back around, but I put a little summary of that in here for folks who would view the report from the posted agenda, or people who are watching this tomorrow on the YouTube link. After that, I incorporated the text blocks of phase 1, 2, and 3 that we've gone through before. So like I said a moment ago, phase 1 is that remote instruction that we find ourselves in today. And you see the broken out criteria in there. You notice you have disease burden and average percent positivity, but you also, I'll call your attention just a little ways down, from what I understand from the committee meeting, what some people are thinking of doing is taking percent positive and removing it from binding criteria and putting it down underneath in persuasive, which is something we track, monitor, and keep an eye on. And you see that in element 5, trend in 14-day COVID-19 percent positive test results. So were we to take that action tonight, I'd return to this document, strike element 2, and it's already incorporated below as something that we watch and monitor and talk about, but not something that would be gating criteria. I've heard people use that terminology. So it's built right into that document already. If you go to page 3, you see phase 2, which as we go forward and as we work our way back, becomes more and more top of mind. You see this is a hybrid instructional model. You see those same pieces reiterated again, and a brief summary of what this would look like, feel like for families and students who are elementary and secondary. So you see the gradual return of elementary age students, and you see secondary students coming back on like a A-day, B-day, white day, blue day sort of situation, right? Next page, page 4. You see phase 3. And like I said before, this gets us back to our as close to normal operations. That comes a little bit later, and the criteria is reviewed again for all of you there. I added a note just below that, Andy, if you could scroll down, that middle blue box there that you see, that was included in our initial report from back on August 13th. It says students and staff would be excluded from in-person teaching and learning if and when they would A, test positive for the virus, or B, have been deemed a close contact by a public health department. And you notice that it has a hyperlink included there under B. That hyperlink takes you to that what is contact tracing YouTube video that I shared with you a few days back. I thought if someone was viewing from home and they wondered what that would look like or feel like, they could click on that, and that is something I know neighboring districts who are in a different phase of their reopening are working their way through right now. I would also note for families listening later on that once we enter phases 2 and 3, these would become much more bigger pieces of the puzzle we're reassembling here, and Ms. Tark would be sharing additional information, much more granular, with families and community members and staff members regarding how the communication of contact tracing would look and feel. So I put that in there just for a closer zoom if people were wondering about that. Decision points, this again is a copy and paste right from a prior report. What you'd voted on back on the 13th, trend data must be trending down over at least 2 consecutive 2-week time periods to make a switch. If we have 2 consecutive 2-week downward trends, we'll make a decision to switch models after the next 2 weeks. We will continue monitoring using a scorecard, now called a dashboard, in the 6-week model while pandemic concerns continue, switching between models as appropriate. It's easy enough to continue to update the dashboard and put it on our COVID page each week after we receive the data from Medical College of Wisconsin and the health department. In sum, were the board to move percent positivity from binding to persuasive, the change would focus primary attention upon the COVID-19 disease burden. Below are the most recent charts from the Medical College of Wisconsin's epidemiology team for the city of Oak Creek. And these are the same ones you've seen before. I just included them all for the record. So we see when we first got the data, we see at the bottom of page 5, that's the report we looked at our special meeting. Top of page 6, the following week, Then the following week, you see disease burden going down. And finally, right there is our most recent element. And if you look closely at that screen up there, you'll see that it looks a little different. It has, Andy, can you wave your cursor around that critical marker at the top there? See that critical region at the top in like a deeper pink color? Now, Andy, scroll up a little higher, scroll up. So we don't have that on the prior graphics, right? Scroll back down. So like I mentioned at the onset of my little presentation here, right? We're learning things, they're reassessing, and our regional health officers continue to meet, talk, and reassess too. So this different graphic, right, is something that we are first seeing now that is brand new to us, and it's worth our board coming back together to talk about and inviting Darcy here to go into a little more depth with us and talk through. Right, so you'll notice that's different, and it's flagged differently, and I'm going to ask her to talk through that in a couple of minutes. What does that mean for us, and how could that lead to something we might want to talk about updating our plans around? That final blue box, Andy, if you could pull to that. So I noted in the middle there, and this is a copy and paste from another document, under the adopted criteria from August 13th, the report noted that a transition to phase 2 would take place 2 weeks after entering the moderately high range for the purpose of continuing to monitor the downward trend and at the same time operationalizing the necessary changes required to transition from phase 1 to phase 2. I noted right there in the report, given current trends, entering phase 2 the week of the 21st or 28th could be anticipated. Andy, go up to that graphic. So under your existing criteria, you see that positive progress coming down. And that's where we are today. Okay. Darcy, if you'd like to take over from here and share any new information with the board or distribute any documents, I'll yield my time to you here.
Sure. Can you hear me? Okay. So I believe I passed out 2 different packets to everyone prior to the meeting. One is looks like this rainbow chart, and the other is a series of graphs. Okay, great. So just a couple of things I wanted to reiterate before I get into the changes and the different things that we're recommending. As we all know, this is the first time we're dealing with COVID-19 and a global pandemic. We're all learning as we go, and working with real-time data is challenging. So we're doing our best to use the current data to make the best decisions we have, but that's a real challenge to get accurate data real time. The other factor that's really a challenge.
So I'll just interject right now. I know we have Jerry, Mike, Tony, Ben, Josh, Dan, Jennifer, Mario over there at the 9th grade center. So if you're wondering and you can't see this right now, what I'm going to do is Darcy has two additional documents she's brought with us. What I'll do is I'll scan these and link these to this report. So when you go back and look at this tomorrow, you'd see these updated and available for anybody who wants to inspect them linked on there. So I'm sorry to interrupt, Darcy. Go right ahead.
Thank you. The other challenge that we as local health departments are dealing with is really a lack of strong state and federal guidance, which really leaves each local health department or each region or each, of each state to try to use the data and make the best case recommendations based on the science. The Milwaukee County and Southeastern Wisconsin regional public health officers meet almost daily. On a regular basis, we're looking at the new science and data that's available to us. And it is our intention to continue to update the recommendations based on the latest information that we have. To my knowledge, we have all these recommendations that I made previously and that I will be making tonight were developed jointly across Milwaukee County. And I believe that the same recommendations have been shared with the school districts and perhaps the school boards across the county. So this is not something unique to Oak Creek that you are seeing here. Unfortunately, the reality is that there's no perfect metric to determine what the best time is to go back or to transition from one learning model to another. We use the data that's available to us, but all of the data that we have has challenges. And so, again, we're really doing the best that we can with what's available to us in the moment. That being said, I do still highly recommend using data to drive the decisions that you make. I think that that is, again, it's the best that we can do. But for that reason, looking at several different metrics is beneficial, so that if one metric is having some challenges in the moment, the other metrics will be there to kind of help guide the decision making. And finally, really just a reminder that the role of the health department is to provide this data, to provide some guidance, but ultimately what's best for the Oak Creek Franklin School District is in your hands. And the health department is here to be your partner with whichever plan you decide to do. We'll be here with you to support you and try to make it as successful as possible for the families in the district. So at the last meeting in mid-August when I was here, Dan and I mentioned that we were anticipating that the State Department of Health Services would be releasing some metrics that would help school districts make these decisions at any point. Unfortunately, the following week, the state decided they were not going to release those metrics, leaving once again local health departments responsible for making their own recommendations. Fortunately, as a county, the health officers were somewhat prepared and we had already provided some metrics, but that spurred us to really have another conversation around the metrics that we had provided, look again at some other data sources, including what the state had put out, but also what other states had recommended, what the Harvard School of Public Health had recommended, some other reputable public health sources. And that caused us to make a couple of changes to the recommended metrics, which I wanted to share with you today. So as Dan mentioned, let's see, if you look at this document that has kind of the rainbow on it, what we did is we added at the kind of the highest level of new cases, we added this critical level. So that means that previously the highest level of burden was high, which was more than 100 cases. We've now added critical, which is more than 350 cases per 100,000 people, which means the high range is now between 100 and 350 cases. And as a result, the recommended learning models all kind of bumped down a level. So you can see that where previously the recommended learning model for high was virtual, that's now the recommended learning model for critical, and high, the recommended learning models could be virtual or a hybrid. And similarly, if you look down to moderately high, those recommended learning models could be hybrid or in-person, based on, again, burden, percent positivity, and the other criteria that have been outlined. The other change that we made was looking at the percent positivity. So we have been fortunate in the Milwaukee area to have good access to testing since early May when the 2 National Guard sites were stood up in the city of Milwaukee. However, looking forward into fall and winter, when we anticipate the need for testing will be greater than it has been thus far, we know there'll be additional respiratory illnesses, which look similar to COVID, which will make more people in need of testing. And we have been told that the National Guard testing sites will be closing within the next couple of months. We are frantically working to stand up some additional test sites and ensure that access to testing that testing remains easily accessible. But knowing that that could fluctuate and could change, we wanted to make a change to percent positivity that reflected that challenge that could be ahead. So as a result, if you look down under table 2, additional criteria, where previously we had the percent positivity would be at or below 5% over the previous 14-day period, that is still the ideal. However, our recommendation now is that if it's between 5 and 10%, and we're seeing a downward trend, that could be a sign that it could be the time to move into a different learning model. So those are the 2 main changes that we made. I did also provide some additional data, just trying to share anything that might help you have a better understanding of kind of the journey, maybe you say, that we've been on with COVID since early March, how it's looked in our community, how the case numbers have changed over time, and just give you a better picture of that. So I would be happy to go through those one by one if you wanted me to, or I'm happy to take questions if we wanted to jump into that.
Darcy, why don't we start with like an executive summary of these charts you brought here? So just like, you don't have to go through granularly each one, but just give us a sense of what you brought for the board to look at here.
No problem. Yep. So page 1 looks at, going back to March, the number of new weekly positive tests. So one thing to note is that each person who tests positive is counted only once. So some people do get tested again after that first test, but we wouldn't count that as 2 positive people. We would only count that as 1. So that's a question that I've had a couple of times that I feel like is an important point to make. You can see, of course, that we had our highest number of cases between mid-July and mid-August, and we have started to see a decrease in cases since that point. The second page looks at the total number of individuals that have been tested each week. So that would be those who have tested positive and tested negative. Similarly, we saw our highest number of tests being done on Oak Creek residents in that same time period between mid-July and mid-August. The third page is the same burden graph that you saw in Dan's report. This is the most recent one. So our most recent burden number for our most recent 14-day period was 161.88 per 100,000 residents. And just a reminder that we use the actual number of positive cases in Oak Creek, but then we divide that by the population and multiply by 100,000 to get that rate of how many cases per 100,000. There's a couple of reasons for that. One, because that's how the thresholds are determined, so that easily allows us to see which threshold we fit into or which category we fit into. The other is because that's how other cities and states are doing it, and it really allows us to compare the impact of COVID here in Oak Creek to the impact of other areas in the state and the country. That second burden graph you see is all of the Milwaukee County suburbs combined. So you can see that when we look at all of the suburbs, so all of Milwaukee County minus the city of Milwaukee, the burden is about 140. So we're slightly higher, but not too far off what the average burden is here in the county. That next page shows a graph of the percent positivity going back to July. So we can see, as you are already aware, that we have seen a significant decrease in the percent of individuals testing positive out of the total number of individuals tested over a 14-day period. And that table at the bottom shows the comparison of Oak Creek to Milwaukee County. And then that final column just has the range. So amongst the, I believe there are 19 municipalities in Milwaukee County, what's the range of percent positive at a given time? So you can see that going back even to mid-July, we have had municipalities in the county that have been right at or below that 5% positivity level. We've also seen municipalities that have been quite a bit higher than that. The next page is looking specifically at children in Oak Creek. So this is showing the number of new weekly positive tests among children 0 to 18. One thing that I think is important to note here is that you can see that the vast majority of positive tests among children have, children have tested positive from July on. So I believe 83% of all childhood positives came in July or since the beginning of July, most likely aligning with when we started to see children going back into the community and gathering more. I think before that, many of us were keeping our children home pretty exclusively. And then the final page shows a heat map similar to what you've seen before, but this is just looking at children ages 0 to 17, I believe, testing positive in Milwaukee County. So I showed the 2 most recent heat maps that we have for that. And so again, this is just new cases of COVID-19 amongst children during that 7-day time period. So you can see how our kind of rates of children testing positive compared to the rest of the county. And those are the graphs that I have.
So Darcy, if I could ask you just one more time to take us back to the color-coded document and walk us through just one more time how incorporating these new cut lines, or however you refer to them medically, I don't know, but for me it's like a student data cut score or something like that, how this would, how it came to be updated and how it would change our potential learning model or could change our potential model upon incorporation.
Sure. So like I said, after the state health department reversed course and decided not to provide the guidance and metrics that would be used uniformly across the state, the Milwaukee County and Southeastern region, for that matter, health officers got together and looked at the metrics that we had already recommended, looked at some additional, like I said, sources, what other states or other public health entities were recommending. And that resulted in us deciding to add that top level, that critical level. So that is something that's in line with what the Harvard, if any of you have seen the Harvard Path to Zero report, that's in line with that top level that they have in their burden or activity level threshold.
Could you take us down one more time to table 2? Because if I'm reading this correctly, like we find ourselves in red, right? High, not critical. And if I read across the graph, it says virtual offering is available, which we have. We have nearly 1,000 students participating in that. But if you go a little further on your table, under hybrid blended learning, it says assuming criteria in table 2 are met, physically distance exercise caution, right? So if we go down to that table below there, could we just talk about that for a moment or two?
Sure.
Yeah.
So those are the additional criteria that we've recommended considering as you look at which learning model to choose. The first is percent positivity, which we've talked a lot about. Previously, the recommendation was that we would want that at or below 5% to consider moving to a hybrid or in-person learning model. At this point, given the fact that we don't know if testing will remain as easily accessible as we move into the coming winter months, we've made the decision to recommend that if the percent positivity is between 5 and 10% positive, so that means 5 to 10% of the people being tested are testing positive during that 14-day period, and we're seeing it trend downward, which we have been, then that could be a trigger to move into the next learning model. We also have the number of cases. So looking to see if the number of new confirmed or positive COVID cases are trending downward, both in the county and the city. Given the graphs that I showed you and what you can see if you've looked at the Milwaukee County dashboard, we have seen a sustained downward trend in the number of new cases. And then looking at the hospital care, the number of making sure that hospitals are not in crisis care mode and that there are sufficient hospital beds for anyone needing one, and that has been true for quite some time. So the rest of those criteria are currently, are meeting those criteria as well.
So just for the purposes of kind of summing up out loud for the group, like were the board to come forward with a motion to move percent positivity from binding to persuasive or update it to reflect this most recent guidance, right? That would be one factor that we would look at, right? The other one would be to ask me to incorporate all of this new information into our criteria. That'd be something else that the board could ask, or any variety of other things that you can think of. So, but just like on the face of it, I see 2 pretty critical pieces here that the board would have to direct me to incorporate into or out of or update in our current documents. So, and I've got pen in hand, ready to labor over these changes. So, okay, thank you, Darcy. Questions for Darcy or me or anything like that?
Yeah, I have a few questions. First of all, I want to thank you again for your continued partnership with the district and the board. We appreciate that. Most of us have no healthcare background, and so appreciate your expertise. I wanted to ask some questions that I know some people brought up tonight, as well as I've gotten some emails on. I have read some articles, but again, speaking to the question about kids are generally asymptomatic or mild symptoms and or no evidence that kids are spreading it to adults. I've read a couple articles, but I guess I would be interested in hearing your thoughts on those 2 questions as well.
Sure. So I think one challenge is that we have very limited data on how kids do or don't spread disease, because we have largely seen schools closed since the beginning of the pandemic. And while, some daycares have been operating there, it's quite a different environment than a school generally in a daycare. I think the best or the most comprehensive research that we have comes out of Korea, and that suggests that children who are under the age of 10 are probably less likely to spread disease than adults, but that children ages 10 and above may spread disease at the same or even higher rates than adults. I think that we're going to learn a lot over the next couple of months as we see schools transition back to in-person learning. And, we may have a different answer to that question in a couple of months once we have more data, but right now it is pretty limited.
Sorry, Darcy, why is the 100 so risky on the trend rate when you think about what's our number, 168, 162? If I take that as a 7-day, 14-day, consecutive, that represents a little bit over 2% of the city of Oak Creek of positive cases. But then I look at other schools that are in Oak Creek and think of two right away that are open fully in. Been longer than a week, and there's also one close high school that's hybrid model. I'm hearing no issues. You might be hearing different. But why is the hundreds? Why is that such a risky number? And I know now it got adjusted, but still considered risk. Why? I'm just curious, because when you look at the number side of that, it's extremely small, right? And so, because I dug into numbers. So 2 weeks ago, we had 37 positive cases. Last week, we had 39. Even though it's not on this graph, but I looked into it. But there's a combination of several of those came from nursing homes, first responders, people that there's one individual that within a household that's tested positive. Other people within that household got or were eventually became positive, right? You subtract that out, the numbers go even down even dramatically, right? And you can tell me if I'm right or wrong on that data, but those are the three top criterias. I didn't see anything on the amount of children, right, being affected by it. I'm just curious because I look, again, we have 2 schools within Oak Creek that are wide open, and I haven't heard nothing from it. Now, I know it's early stages, but also there's many day camp and other facilities and programs open that have it. And I'm still saying, but the numbers are extremely, extremely strong. Now, obviously, we want to get to 0, right? That's my best thing. But I just curious why that's such a stickler number for us.
So those thresholds were set by the state health department. They're in line with what the Harvard model recommends. And the state health department modeled them off of the CDC guidelines. So they're not thresholds that we as local health departments developed. They were developed by epidemiologists and other scientists who look at the risk to the community based on the number of cases. One thing that I mentioned last time and is worth mentioning again is that we know that the number of people who have actually tested positive is just a percentage of the people who are actually have COVID in the community. Estimates vary. It could be most of them, it could be only half of them. But we know that if that many people are testing positive, there are probably others who may be unaware that they're positive or who may be ill but choosing not to be tested and could be spreading disease. I think that while we certainly look at all of those things you mentioned, if there are cases in long-term care facilities, if people might have been exposed to COVID through the course of their job, even if those things are true, we know that those people still largely interact with others in our community. So you might be a law enforcement who maybe was exposed at the job, but you still go grocery shopping, you still go to your child's soccer game, you still do other things in our community, which could expose others. Same with long-term care facilities. We know that the way that COVID enters long-term care facilities is through staff. Many of those staff live in our community. They're being infected while they're out and about in the community and then taking it into a long-term care facility. So it's very hard to determine where someone picked up COVID. We certainly look at all those things, but I think we have to remember that even if we know they were exposed on the job, that doesn't mean there's no risk to anyone else in the community.
So are the other 2 school districts that I is referencing.
Mhm.
Are they just ignoring the 100 number then?
Like I said, these metrics have been provided to all of the schools here in Oak Creek, as well as, I believe, all of the schools, districts and school boards across the county, and each has made their own decision about what's the best plan for them. You know, it's not the health department's role to decide what that plan is. We can make the recommendations. I think another important point, though, is that, you know, we want to set up schools to be successful. So starting back to in-person classes when we have low levels of disease in the community and low levels of community transmission sets us up to be more successful than if we start when we know we have a lot of disease in the community, and then right off the bat we might be at risk of having kids or teachers impacted and starting with quarantines right away. Certainly, I can tell you from conversations that I've had with other health officers in the region whose schools are back in session that many of them have had already classrooms or grade levels or groups of teachers quarantined. And so it's not that schools have not been unscathed thus far, I would say.
Quarantined, but not closed.
Right. Right. I'm not sure if any school has closed entirely.
So the heat map, if you look at this, the last one I have is red. This one is more blue now and yellowish.
So this is just a child heat map.
Yep.
So I haven't given you, I don't think that we've shared that one before.
Andy, could you scroll down on the main graph that's there? Frank, that's the most recent everybody.
So this is the community-wide heat map with all ages.
Yep.
So, but it has certainly gotten better. Yes, it has, as we've looked at these over the past month or so.
But as children, it's completely different.
Right. Children we have lower numbers of
Yeah,
children.
4 pieces. Okay.
We have lower numbers of children testing positive. Another thing that I think Dr. Jarrett might have mentioned this when he was here last time, is that we know that children get tested far less than adults. So oftentimes if a child, for example, lives in a household with someone else who's tested positive and that child is sick, the recommendation from the pediatrician would be, it's not really worth putting that child through the test. We can reasonably assume that they have COVID, keep them home. And so again, I think that we probably are seeing lower numbers of children testing positive than the actual numbers of children who have COVID disease in the community.
It just shocks me because our neighborhood district, who positivity numbers are higher than us, is wide open. And their positive cases numbers are a lot higher than us.
But they made that decision to open when their positivity was lower.
No, I understand.
And theirs has climbed up. So.
But I mean, they're not forced to shut yet. That's all I'm saying so far.
Frank, I'll just note that they had a soft opening last week where they had, I believe, 20% of their students in the building each day. And I believe today marked their first day in full session. Andy, you can interject if you want to. 25, I'm sorry. Thank you. 25% of their students per day. And today marked their first full reopening. So an important point to make.
Yeah.
Darcy, over here. On your child data sheet, it shows from March 13th to August 28th. Basically, 72 kids in Oak Creek under 18 have tested positive for COVID. Is that correct?
Between March 13th, are you looking at this one?
Yeah.
And September 3rd, we had 81.
Okay, 81.
Yep.
Okay, that's the last ones. Okay, so 81 for 5 months. Is that correct? And it went. The peak is right after July 4th, technically.
Right.
Everyone's
So
saying
it's about 10% of our total cases.
so it's been dropping 10%. Right, it's been dropping so fast, rapidly, from what I'm understanding. Now we got Labor Day; it just came through, obviously, so we don't know if it's going to spike back up to 18 or whatever. But right now, I see a huge from July numbers to August, end of August, a huge drop. Yeah, that's a big drop.
Yep, and that's in line with the drop in cases that we've seen across the community. Yeah.
Right.
Darcy, can you speak a little to how the health department and or the CDC opted to use burden rate and percent positivity as maybe the main metrics that are looked at, as opposed to, again, some people asked active cases, new cases. How was which metrics are more important determined?
Sure. I think if you look at the various metric recommendations from different organizations or across states, you'll see that burden, which is sometimes called other things, it's sometimes called incidence rate or sometimes called activity level, but you'll see that these are the two metrics that are most commonly used across the country. The The burden is meant to take a look at what the current level of active cases are. The challenge with using the number of active cases, which I know is being calculated from, people who have tested positive, subtracting death, subtracting recovered, is that someone doesn't count as active until we as the health department close their case. And so while we do our best to close those cases as soon as we can, I can't always say that on the exact day that a case should be closed, it is closed, depending on how busy we are or are not. So burden is a more reliable metric. It doesn't rely on a person at the health department actually physically closing a case to show up in that case number. Looking at the number of new positives over the past 14 days, the isolation period for someone who tests positive is a minimum of 10 days. And so the vast majority of people who test positive over the past 14 days are still in that isolation period and would still be considered infectious. And so it is a reliable metric for looking at the current level of disease in the community. And the percent positivity metric is important because it really helps us to understand if we're testing enough. And we really need to be testing enough to have an understanding of what the current level of disease is in the community, and to identify those who are currently positive and keep them, as well as those who they've exposed, home to reduce the risk to the rest of our community. So looking at those two things together tells us how much disease is there, and then are we testing enough to make sure that we have a good understanding of that and to keep people home, lowering risk to others.
Regarding the 14-day watching things for 14 days, does that relate then to what you were talking about before about watching so that to see who's actually becoming positive, because it takes 10 to 14 days possibly for a result to come back?
So
not
we
come
are
back, but for results to percolate.
Sure, for the viral load in the body to, yeah, exactly. So, right, after someone is exposed to COVID, we know that anytime in those 14 days after that exposure, they could become sick and they could test positive. So that's the reason that we use that as a quarantine period. So if you are exposed to COVID, we will ask you to quarantine at home for 14 days after that exposure, so that if you become ill, you aren't exposing other people in the community. I know you didn't ask this, but your question made me think of it. I wanted to say that we have seen a huge improvement in the length of time it takes for test results to come back. So earlier we were seeing where someone would get tested and we might not get test results for a week, which made contact tracing very challenging, because then we're calling someone and saying you were exposed 10 days ago. They had no idea and they're out about in the community. Now we're seeing test results come back in 1 to 2 days. So that process is going much quicker, and we are confident that we're notifying contacts earlier and asking them to quarantine earlier in that period.
Okay. Have you had any, I'm hearing out in the community that there's not as much testing because there's not as enough test kits available. Are you finding that that's a problem?
There is no shortage of test kits here in Wisconsin, and especially not in our area. So we have seen in other parts of the country where they've had some shortage of testing materials or laboratory capacity, but that is not something that has been a challenge yet here in Wisconsin. So while we did hear the CDC, I believe, recommendations around testing change recently, the state health department is still recommending that anyone who has symptoms and anyone who's been identified as a close contact consider being tested, because we do not have limited capacity at this point.
And Darcy, I think the last time you were here, you were at like maybe 300 cases that you were tracking. Do you know how many you're tracking right now? As far as currently quarantined? Or?
Yeah, I believe it's right around 50 with today's numbers.
50? Okay. So as far as the capacity for the health department to do the contact tracing right now, with it being that low?
Yeah, we're in a good spot right now.
Okay.
Could you clarify one thing? So I understood you to say a little earlier that we were concerned about some sites closing. Some testing sites closing,
yes.
But which led me to believe that it may become difficult for people to get a test when they want one. But then you just said that there's no shortage of test kits. Could you draw the line between those two?
No
issues
problem.
for me?
So we haven't seen that happen yet with the testing sites closing, but we have been told that the National Guard, who's been operating the two most accessible testing sites in Milwaukee County, at UMOS on the south side of Milwaukee and at Custer Stadium on the north side, the National Guard mission will end by the end of this year. And we've been told that those two testing sites will likely close within the next month. And so when that happens, if we're not able to respond quickly enough and band together as health departments to stand up additional testing sites or work with the healthcare systems to increase capacity, we might see more difficult people having more difficulty accessing testing at that point. Right, exactly. And that's the reason that we made the change to the percent positivity, knowing that that could happen very soon. And we didn't, while we were changing the burden metric, we thought it made sense to change both of them at the same time.
Dan, can you speak to staffing? I know that was a question as well that was asked and I've been emailed about as well.
Sure. So staffing, as you all know, is something we struggle with every single year, but it's a real point of pride that we've been able to start at full staff for many years in a row now, right? We have a very aggressive human resources department. We are at full staff at this moment. And as you know, our staff is reporting to our sites. We've also incorporated those limited term teachers for the OC virtual program. And Troy informed me this morning that Teachers on Call is still supplying subs to districts requesting them. All right. So if we need them, they have them. That's for the time being. Right. Their workforce is experiencing the same changes that many others are. Right. Many of our drivers for Rightway, many of our folks who sub are folks who've retired from other professions. So at this moment, right, we have our staff in place. Right. And TOC is reporting that were we to request subs, if we needed them, they have subs today. All right. So later on, when we move a little further down the road, we'd have some other internal stuff that we would talk about, like our staffing rates. Like, do we have the staff to move forward? And at this moment, we do. Right. But that's something that this board, our human resources department, we're going to have to monitor that all year. It's going to be a continuous dashboard sort of situation, like once we're back in session, either in phase 2 or phase 3. Does that answer your question? Okay.
And Dan, real quick, you said you need 2 weeks start time before we go back face to face.
So we've been operating under that since you guys adopted this on the 13th, right? So the various departments, food service, transpo, right? Since the 13th, we've operated under the assumption that we'd have that 10 working days window to turn the dial. Right. And then once we got back into session, we would be monitoring internal criteria in a different way. Right. This is
right. I understand that. Yep.
Entry, exit would look different than this. It would be more to Jerry's question from earlier in the meeting about staffing and Jane's follow up here about do we have the staff to continue and coordinating with Darcy based on our local experience. So.
Yeah. You don't want to pile too many kids in one room. I understand that.
Right. Right.
I was wondering, could somebody, either Dan Thielen or Dan Unertl, maybe just give an overview of how things are going in the virtual department? There's some of the speakers commented that they were hearing a lot of negativity. I've heard kind of the opposite. I've heard that things have actually been going very well. A few little hiccups, but they seem to be more technology based, and they seem to have gotten worked out based on what I saw on social media and a few other places. So
I'll go first a little bit, just anecdotally. Like, I get a very different kind of curated feedback loop than a lot of other people throughout the district do. Okay. Like, often I get contacted when there's problems, right? Rarely do people reach out to me to say that this is really wonderful. Thank you. This has gone really well. It's just, and I'm not complaining. That's just kind of how the job goes, Right. So since we've started virtual, you all know it's no secret. Like, there's plenty of people who didn't want that to be the way we began the year. Like, you all know it's no secret. Like, I wish I had kids in the buildings to go visit and our teaching. Yeah, right. So there were some people who were ready for the experience to be very much like spring. And I think our staff has worked very hard since spring to make this a better experience under less than ideal circumstances. So everyone in this room knows we changed our professional development allocation. We had staff started over the summer. People did a whole bunch more PD in a different targeted area than we've had them do before, and our teachers rose to that challenge, right? So the feedback I've received, and like I said, I get kind of a different picture. I got a fair bit of, hey, this specific problem has befallen my family or my kid. I've gotten some pretty heartfelt messages about struggles people have endured. and that's hard and that's true and that's people's experiences. And I know you've gotten that too.
Right.
But I've also gotten a fair bit of, this is much better than I expected. You guys have done a good job preparing. This is a lot better than spring. I've gotten a bit of that too. And that's been good to see, but I'd be exaggerating if I pushed it one way or the other. So in terms of my anecdotal experience of people who've reached out to me, it's been pretty down the middle, 50-50. Hey, this has been hard for my family. And this is better than I expected it to be. So Dan or Bridget, do you want to add anything based on people who have reached out to you?
No, I would echo with what you just said, Dan. I have, over the last few days, received a number of positive emails from parents with regards to the start of the year, other than a couple maybe technical hiccups, but a lot of the ones I received were, it's much better than it was in the spring. They're happy with the progress that we've made. They can see that a lot of time and energy has been put into this and that. So there's been some good feedback on that.
No rose-colored glasses though. Everybody'd rather have their kids in front of them.
Right.
Less than ideal. But I think we'd be remiss if we didn't point out how hard the staff is working right now and how much effort and planning has been put into these various different plans for people. So there you go. I hope that answers your question.
Yeah. Thank you.
Cheryl, real quick. Speaking firsthand, K4 is a tough one because our daughter's in K4 and working an iPad. It's tough for her, but it's a learning experience. You understand what I'm saying? So it's taken her time. She's finally learned how to mute and unmute, and stuff like that. So it took her 2 days to do it, but she's finally figuring out how to do that part.
Right.
She still needs help signing on, obviously.
Right.
She's 4 years old. But then on the flip side, I've heard nothing but good things from the teachers on the older kids, second, third on up, that they know how to navigate hiccups like you guys are saying, but it's working. It's a work in progress. And obviously it's like a college course for everybody, and staff included. But I think it's doing good, but the little ones that don't know how to read or nothing, that's the tough part right there. But with the parents' help and stuff, it works great.
And no doubt, Darren's got his thumb on it here. It's the younger the kid gets, the harder this is, right?
Okay.
And to a point that's been made earlier this evening, I think regardless of where you are or how your district began the year, teachers and families are going to find themselves at some point, at least there's a high likelihood that they're going to find themselves at some point experiencing some kind of remote learning this year, unless standards change or treatments emerge or whatever, right? And here, just say we start moving forward, continue seeing this positive progress, find ourselves in a new format. So when that eventuality comes around where some of our students find themselves in quarantine, I think our staff is going to be in a good position to continue to provide education whenever that does happen, right? We've ironed out a lot of tech infrastructure issues in the last couple of days, and I'm not going to lie, there have been plenty. No doubt you've all heard that, but our tech team, who you've seen tonight, either in here updating some of your equipment or working over at the NGC for public comment, the first day they had 300 plus calls for everything from home Wi-Fi router issues to password issues, and that has steadily declined as the days have gone by. Our tech team, if I could just highlight one group tonight, has worked extraordinarily hard to try to bring this together. And one of the benefits is wherever we find ourselves going from this evening, we'll have done good, positive work toward providing the kind of infrastructure that we need going forward. I've joked about this in the past, that we'll never need to worry about losing a day for a snow day again. So,
Dan, could you maybe give us a definition of what persuasive metrics mean? I think I've heard from a couple of parents that they don't understand why we even have to include the persuasive if there isn't really any kind of way to judge or measure that's been publicized.
So let's just break it down real quick, right? A binding metric would be like a gating metric, right? I think everybody gets that. We're shooting for that 100 or we're shooting for that 5% unless we adjust those tonight, right? So that makes, even if you don't agree with the metric, at least you understand on its face what you're looking for, right? Persuasive data is a little bit different. That's stuff that you would look at, that you would review, that you think matters enough to have on the table as part of the discussion, but it's not necessarily gating, right? So, for example, persuasive data on our first table on page 2, we have subbing or staffing shortages, right? So it matters, but it's also incumbent upon us to solve those and be creative like we always have, right? If we're having a staffing shortage, we should be actively working nonstop on figuring out how to staff, figuring out how to creatively sub, like how can we manage this? So this is something that historically we've been able to manage in this district, right? Before COVID, I've never had to appear before this board and say, we're short staff, we got to shut down the school district, right? So that matters, but it's something we have some degree of control over internally, right? And it's something we should pay attention to. And if we find ourselves in a position where we don't have people to appear in front of our kids, that's going to make a difference for whether or not we can effectively cohort kids and keep the mitigation measures up and in place. So at some point, like once we're into a new world of learning here, we'll have to know, what does that mean? Like, what does it mean at Forest Ridge to have a staffing shortage that equals we have to be remote today, right? So at this point, we have all the staff we need to operate. Teachers on call reports that they can supply subs when we need them. We're in a good place. So this is important to talk about, but we're there and it's met. It's not necessarily gating for entry purposes.
Mm-hmm.
Might this not be gating criteria for transitioning back to a different format or finding ourselves in a 10-day site-based quarantine? Yeah, it might matter a lot later on once we're into phase 2 or phase 3. But right now it's met. It's just important to talk about. Each one of those pieces, it's worthy of discussion, but it isn't like the key linchpin that controls the decision-making process. At least that's how I've described it to people who've called before. It's a legal term of art too, like persuasive data or persuasive information is something that might matter to look at. It's important. It could lead you in one direction or another, but it's not like the dispositive criteria that would solve the issue.
Mm-hmm. Okay.
Fair enough.
Yeah. And my other question was, OC Virtual is Edmentum, right?
So Dan, could you talk a little bit about the distinction there? Who's using which curriculum, how it kind of changes from 4K through 12th grade? Because what we have here is we have some of our staff, we have some temporary staff,
Mhm.
we have some supports in place for our older students. Like it's worth a couple of minutes to go through again. So
Well, I'll just add though that I just have had a couple of parents that have said to me, if we do go back sooner than what was anticipated, my child will still have a choice to go and stay in OC Virtual, right?
so whatever you choose as a board to do tonight,
Right.
The people who are in OC Virtual, right? They're in their own program, right? OC Virtual doesn't disappear.
Right.
If you said do this, do that, do the other thing, they have a seat. They're in their program. There it is. We have
I
not
just think there was
indicated
some confusion by calling it OC Virtual, and then there's Edmentum, and they're the same. They're one and the same.
one and the same.
right?
Yeah,
Right.
one and the same.
And I agree. I've seen a number of comments on Facebook about, my kid is or isn't getting this, or I'm having trouble with this. And I'm seeing people try to help and answer questions. And sometimes I think the question came from someone who's as part of Edmentum and someone in the district is trying to answer, or vice versa.
Mhm.
So I think the clarification would help for some people.
It's been very helpful to have Steve Anderson as the oversight principal working with our younger kids and having some charge administrators at the high school working that out, because we'll get calls here if they've tapered off a little bit with very specific questions, and it's been very helpful to have a key administrator who can do that. And you've all known Steve for a number of years. We were lucky enough to be able to temporarily backfill behind him with a retired administrator over at East for the time being. And the high school, we had enough people sign up for the virtual program at the high school that we could fill it internally, which was very helpful. So Kim over there, who you've known, has been instrumental in helping with that as well. So.
Good.
Like I said, not without kinks, right? Here we are in week 2, but we're getting there. And I wrote that in here too, because I had a fair bit of inquiry about this report too from families in OC Virtual.
Mhm.
And the answer for them is, you're in your own thing. Whatever happens tonight, OC Virtual, you're okay. Call Mr. Anderson or Miss Sal if you've got questions.
Mhm.
So, yeah.
I think one thing I just wanted to maybe make as more of a statement. Again, I heard tonight, but I've also gotten a number of emails questioning the teachers and the teachers union feeling like decisions were made because we were threatened by things like that. I have heard from teachers and students and parents and community members, and I don't think I've felt, and I'm just speaking for myself personally, any more pressure from one group or another. I don't want any group to take a bad rap that I don't think deserves it. I'm again just speaking from personal experiences. I heard my teacher or my daughter's teacher say this week, I'm excited. There's a meeting on Tuesday to talk about how we might reopen. I'm really looking forward to seeing you guys in person. And I think if you talk with most of the teachers now, the work they are doing now to pull this together virtually, most of them will say is harder than if they had kids face to face in front of them in the classroom. So I'm just speaking for myself, not as a board. But I've often kind of heard the teachers and or more so teachers union getting, I think, a bad rap. And I just want to say for me personally, the decisions I made were not based on feeling threatened by the teachers union.
I strongly concur.
Well, I'll add one thing in kind of a related way. You know, our staff have been reporting to the sites, right? And that I think has proved to be very helpful in planning for whatever comes next and working through what we're doing right now. Right. And I personally, and I'm the superintendent, so maybe I don't count, but I haven't had any teacher contact me and like upset about our decision to have them report to the buildings, right? Which I know has been a subject of discussion in some neighboring districts and nationally that you might see on the news. Like our staff in Oak Creek knew that here we are, like there's a big job of work in front of us. Right. We need to incorporate all that we've learned based on the spring and do the best job we possibly can in the fall. And our staff have reported and done that work. I met with a small team of teachers this afternoon to talk about mentoring our 51 new people this year. 51, that's the most we've had since Act 10, right? It's our mentors, you know this, I've worked with the mentor steering committee since I've been over at district office. It's a great group of people, and every year we assign a mentor to our new teacher that follows them for the first 3 years of their profession. And I think it has a lot to do with our retention rate here in Oak Creek, how we retain so many of our staff. We help them early on. So 51 new people this year, right? Reporting to our sites, staff telling me that it's nice to have time to collaboratively plan together, and they have appreciated the requirement for some synchronous learning, which is one thing that parents have pointed out too. And you remember that's different than what we did in the spring. Right. A lot of people wanted that synchronous component. And Dan and company have worked very hard to make sure we could operationalize that synchronous component. I think the staff have liked that. And Jane, to your point, I don't think we've got a teacher in this district who doesn't long for kids in front of them again. You know, I know that like that's why I taught, you know, like 32 smart kids asking good questions, sitting in a circle, talking about books. Like that was my career. And I think all of our staff like want that too. So
when we do move into hybrid model for specifically at the higher grade levels, what does you mentioned AB days, you mentioned blue, white days. Do we know what that looks like?
So part of it is as we get a little bit closer to a transition here, right? Like if we are incorporating these elements and we're getting closer, like all of our families are going to have those questions. Like right now, we've said in a very broad sense that Phase 2 equals a gradual transition of elementary students and a hybrid transition of secondary students. And that's been acceptable for the time being because we've been in another world. But as that date of change gets a little bit closer, people are going to want a lot of additional information. So Mr. Thielen and his team have been working on very granular communications to families that help them plan their life, right? And how to align even the first couple of days so the gradual transition of elementary students aligns with the programming for secondary students so you don't have upset apple carts in households, right? So Dan, do you want to give us just a very like high level overview of what hybrid learning would look like in the first and second week and how we would be communicating that to families?
So in the first week, so if we're talking all students in grades 4K through 12, each of those groups during that first week are going to get a couple days of in-person learning and then a couple days of asynchronous learning. And then what we have planned on doing is that Friday of that week that everybody would be remote learning on a synchronous level. So it would be approximately about 2 days of in-person learning each week with 2 days of asynchronous and then a full day of synchronous. So that would be the first week as we transition in, as kind of we've been using those terms, that soft opening. The second week, the secondary level would continue on that path because of how large our secondary schools are, the fact that we can't necessarily cohort them like we can with the elementary schools. We've heard Darcy talk a little bit tonight about some of the data from Korea with age ranges and so on. But in essence, that starting that second week for elementaries, they would be 5 days, but they would be 5 days in person, but they would be cohorted. So they would be with their cohort of students together throughout the day. Specials would come to their classroom. They would eat their lunch together. They'd have their recess together. So they'd be a little family that would be there the entire day with mitigation measures in place, all the hand washing, the sanitizing, all those different types of health protocols and so on that we have worked to put in place in that. So, but the high school again would continue on with the 2 days of in-person, 2 days of asynchronous, and 1 day of full synchronous.
So one of the challenges that I've asked the team to prepare for is reiterating some of those early messages that our offices shared during the summertime, right? Because we talked about a lot of the stuff Mr. Thielen just highlighted, but then when we change to remote instruction, some of that stuff becomes less front of mind. So as soon as we start gearing up towards that transition, like those communications come out again, help people understand it. And just to be perfectly clear, one thing we've worked really hard on, just say you're a parent in the district and you have a kid who's in 3rd grade and a kid who's a high schooler, right? We wanted them kind of lined up so you don't have dramatically different experiences throughout households, making it very hard for families to plan, right? Like I've talked to a lot of families who were really scrambling to figure out what does September look like. Because if you think back to our August 13th meeting, I know we had talked about 2-week periods of time and 6 weeks, but I think Frank was very clear about if you're following that exactly, that gets us to right around the end of the month, the beginning of next month for a return. So I think a lot of families made plans to figure out what their life looks like for September.
Right.
And I think it's important that whatever our teaching and learning team is communicating with them going forward is very conscious of those challenges that families are going to continue to experience.
Right.
Just in case we're in that phase 2, just say we're in phase 2 for a number of weeks, for an extended period of time. Like, we want to be very conscious, or at least as conscious as we can,
Right.
despite how inconvenient it is for the families in our district, if that makes sense. So if you're on blue days or white days, right, your whole household should be within reason as much as we can on a blue or a white day.
Okay.
So,
Thank you.
Dan, did I say that
question.
right? Did I muck that up, or was that about right?
No, you said that right. It's going to be loosely based on alphabets. You've seen A through K or A through L. It'll be loosely based on that, but we do understand that we have about 90 households in the district with roughly 245 students that have multiple different last names within a household. So to Dan's point earlier, we want to make sure that we're providing that convenience for the parents to help them out, knowing the challenges that they're facing.
And nobody thinks this is ideal by any stretch of the imagination, but if we can make some modifications like that to help people to a degree, I think we have to make them. So
My other question is, when we go back in person, if there is a quarantine period for a specific child, is that child able to continue to do remote learning during that quarantine period?
Yes, they will. Mm-hmm.
So, and the other wrinkle to that too, Amy, is like, what's the situation for a staff member who's on a quarantine, right? How does that work as well? And we've worked that through with folks too. Like, you could very well be quarantined for, let me think for a second, it could be 10 business days. We could be in session all 10 of those days. Perhaps your students are in that same circumstance. Like, these are some of the really challenging phase 2 hurdles we're going to climb over that you're seeing play out in districts that opened in a different format than us. Like I watch Channel 12 or something like that when I get home, or see the Wisconsin Education News like many of you do, right? So there's some school districts that opened in a different format than we did. And right now that's the challenge. So if you're in 3rd grade at XYZ school and you're under quarantine for the next 14 days, your instructor and the kids, education shouldn't stop if we can prevent that from happening, right? Illness is different. A positive test and illness, that's a different situation. But a quarantine, that's part of being creative and continuing to provide the best quality instruction we can. And talking before about our infrastructure challenges that we've worked through in these last couple of days, that's where we might be at a strategic advantage as compared to others who you might be thrust into a quarantine with an hour's notice. You get home from work, you have a message from the school, your daughter or son can't report tomorrow, they're quarantined for the next 14 days, or you get a letter from somebody like Darcy in your community. Well, if you don't have your Chromebook, if you don't have your password access, if you don't know what the format of the day looks like for a day when you may or may not be quarantined, that's a big hurdle to climb through, right? And those are some of those 300 calls a day that have gone through our tech center for the first couple of days to kind of work through that. Darcy, did I muddy that at all, what a kid might experience in terms of being quarantined?
Nope, you got it right.
Okay.
Darcy, I have a question for you. For students that don't live in Oak Creek, that live in the part of Franklin that comes into Oak Creek, or kids that come in that open enroll from South Milwaukee, Racine, how do you get notified of a positive contact if it's one of those type of students?
That's a good question. So I ideally, and we're working together as health departments to figure this out, because all districts have this where it's, whether it's open enrollment or a shared district. So we're working on how do we quickly notify that health department where the district is located, or vice versa. If I have an Oak Creek positive who goes to open enrolls to a Milwaukee school, how do I notify them? So yes, we will get notification, but I've also talked with Bridget and Dan certainly about working together so that if the school finds out first, which could very well happen, that they're also giving us a call to say, hey, we just heard about this student. What do we need to do? So I think that we'll have a plan in place to respond quickly.
Good. Okay.
We've talked a little bit with this group and a lot as an administrative team about what actions keep us open for as long as possible, right? Or how can we help families and students understand that, letting us know what's going on in their household, that if you're not feeling well at all, like you stay home, right? Keeping those lines of communication open. Like if we want to stay in phase 2 or phase 3 for long periods of time, which is I think what everybody wants, hopefully the duration, right? And what Darcy highlights might very well become the case where we as a district find out before she does as a health department. So we have to be able to start that contact tracing. We have to know who in our district would be primarily responsible for assisting Darcy with our site-based contact tracing, which is our administrative team and our pupil services team, who would help to some extent, and our in-district health personnel, coordinated by Bridget. So part of that, like I alluded to before, Dan's office communicating what phase 2 looks like. There's a review and sharing of health protocols that's also really important to families that would come out of assistant superintendent for pupil services office as well. So,
do we have an idea yet of how many, like the average number of students per grade level in the elementaries? So I guess I'm looking at if we bring kids back at some point, safe distancing, all that, what's going to be our average number of kids in an elementary school in a grade?
Well, figure the size of our elementary schools varies site to site. You might not realize this, but Shepherd's basically as big as West.
Right.
So some of our schools are much bigger than others, right?
Right.
And you remember too that we've got about 1,000 kids enrolled in OC Virtual across the district.
Right.
So that is basically our second biggest school at this point.
Right.
That functionally brings down our number of students in given classes. And you have to take that on top of what Dan reviewed before, which is elementary age students are cohorted throughout the whole day, right? You're going to have a number of kids in a room, but they're going to be the same kids all together all day long, right? But we've pulled out that it's not quite 1/6 of students that are in OC Virtual, but it's a big chunk. And then grades 6 through 12, right? AB days. So we're halving our total, like cutting in half our total number of students at a site, right?
Okay.
So,
Okay.
go ahead, Andy.
So, in reviewing.
Turn on
You're not on.
So in reviewing our numbers, we do have classes as low as 11 and a class as low as 22, but we typically sit in the 15 to 18 range
Okay.
at the elementaries.
Okay.
So some very nice numbers for the viability of phase
Right.
two.
Right.
Go ahead. I see
Yeah,
Mr.
if I-
Thielen raising his hand.
Yeah, if I could just mention too, with regards to this discussion on numbers, and going a little deeper to Dan's point, as of this morning, we had 550 students in OC virtual in grades 4K through 5, and then in grades 6 through 12, we had 497. So we're at about a total of 1047 altogether. So that will obviously play a role in terms of classroom size.
Right.
Dan, just one more piece of information. If my memory serves me right, it was 508 students who, after the board took action on the 13th, chose to go with the regular face-to-face plan that was now in this hybrid, in this phased environment. So before the 13th, we had 1,500 and some odd students in OC virtual. After the 13th, it reduced to the number you're identifying now. Is that about right?
That's about right. Yeah, we were probably closer to about 1,600 in OC virtual. Probably within the last few weeks, we were down to about 1,100, and now we're at about 1047 as of this morning.
Okay.
Darcy, I have one other question for you. Looking at the color-coded chart you gave us, can you speak a little bit between the yellow and the orange? They both have hybrid and in-person learning checked, and tell me just a little bit about, I know the one says assuming criteria are met and then students in cohorts, but how you see the difference between those two levels?
Sure. I think for the moderately high range, where it says, if you're looking at in person, assuming criteria and table 2, we'd really want to pay attention to those kind of persuasive criteria that Dan outlined before and make sure that they were all looking good, going in the right direction if we're considering in person. The other recommendation is a strong recommendation for having all students cohorted if we're going back in person at that moderately high orange level. And when you get down to moderate, it's, we don't have to worry as strongly. The cases would be lower, so we wouldn't be quite as concerned about everything else and quite as concerned about maintaining strict cohorts.
Okay, thanks. That helps.
We talked about this before, like that's most challenging for secondary students. We're in a good position for elementary age students, but it's harder for older kids, especially our big high school with all those kids there. So.
Right. And I know a couple of people commented in the audience about concerns about kids having access to counselors, guidance, things of that nature. My assumption is they could call their home school, or they could send an email to the principal and they could get them hooked up for a face-to-face or some sort of meeting.
I'll ask Bridget to add a little bit more depth here to this one, but on the face of your question, the answer is yes, but there's quite a bit more to it than that.
Okay.
So, yep.
So currently,
there you go. I think, yeah. Oh wait, I thought I heard her. Sorry.
Okay, teamwork here.
Yeah.
Okay, so during our current state and as we'd go into phase 2, our counselors for K through 12th grade are fully accessible to students. And to your point, Cheryl, yes, any student or parent could reach out to the school to be connected to their counselor. We met this morning with K-8 counselors just to kind of coordinate as a team how things are going. Currently, a lot of those counselors are making connections with families who are new to the district to welcome them, make sure that they're feeling connected to the school. They're also reaching out to families of students who haven't engaged as much with the synchronous or asynchronous learning, just to make sure, one, are they still, enrolled, and then two, like how we can help get them connected to the learning. And some of our counselors are starting to do small groups with the new students, and will continue to serve students in any capacity moving forward. So all counselors, social workers, and school psychologists are fully accessible at this time.
Okay, and since you're on your mic there right now, special ed, has there been any issues with, giving services to our special ed kids, IEPs, things of that nature?
Nope, that's up and running. Our families were very happy with, and I'm very grateful with the turnaround time through which our staff contacted families and really connected. That's going well. We started transportation services today, so that's some of the more logistical pieces that we're working out, just a few lingering cases, but some of the students saw their transportation services start up already today. And I know our business office, together with our people services team, has been really working diligently to help students with transportation and families to access those services.
Okay, thank you.
Dan, that's what I want to ask about transportation with the AB weeks. I know it's going to be kind of maybe a nightmare to get the kids to and from school. Is Right Way ready?
So it's going to be a challenge. Andy's turning his mic on right now because he knows that's his cue. So logistically, go ahead, Mr. Cromie.
So Right Way has informed us that given a 2-week notice, they would be able to be up and running. Given the hybrid model that's been talked about, like a 2 on, 2 off Friday, we would probably be running full bus routes because those names are sprinkled like salt throughout the district. It's not like they all live left of Howell or east of Howell and west of Howell, right? So they're sprinkled throughout. So bus routes will probably all be running. That's approximately 60 buses. But we've been in communication, both Dan and I, with Right Way throughout the summer, working with Nate Hamilton, who is really our district rep over there. So he's been aware of all the steps that are going along the way. He's aware that we're meeting tonight, and we've talked about what that potentially could look like, and so they are fully aware. I guess a plus for us is that at this point, MPS isn't even really considering going back, so we'll have a pool of drivers that typically drive Oak Creek that are coming back, but we certainly know some of those won't come back, and that happens every year regardless of pandemic or not. But there will certainly be a pool of drivers that would typically drive MPS, that they will also have access to pull. So I would presume, because they've told us that given 14 days, calendar days, that they would be ready to ramp up and go. So given that information, I think we would be safe to say that we would be good to go with that.
Okay.
Thanks.
I know that we put a lot of the burden on the parents to do the screening at home. We're not going to do temperature checks, anything like that. There's some districts that have implemented like specific signs and symptoms where a student must stay home, like new loss of taste or smell or shortness of breath or a new cough. Have we thought anything about that, about implementing something like that? Okay, I'm trying this microphone again. Is it working?
Great question, Amy. This is an area that Darcy and I and Dan have been working really closely on. And so we have a pretty solid draft plan of guidance for our schools on just those situations. So it indicates specific symptoms of where if a student's demonstrating one of these types of symptoms that it's above their baseline, or two of the others that it's above the baseline for students, that we will be sending them home for recommended 10 days. And then it lays out return to school criteria about, if they don't get tested, when can they come back? If they test positive, if they test negative, or alternatively, if they see a medical provider and he or she diagnosed with an alternate conditions such as strep throat, that with that diagnosis, they could return once symptom-free and fever-free. So that's been a huge help to have Darcy's collaboration on that, because we're getting that ready. Last week, we gave out drafts of those criteria to some school office staff to review and provide their input, and we will have those ready to go in its final form for phase 2. And in fact, now with day camp going on at the schools, we've had a couple of situations of ill children, and so we've kind of had a chance to work with principals to put that decision making into action based upon information we got from DHS and then Darcy and her team.
And so that'll include an additional education piece to parents prior to going back to school about
Correct. Yep. So that will be much more specific follow-up parent education and guidance from us on the heels of your decision tonight. When we return for phase 2, we'll be probably doing a couple different communications to families on these health protocols, just to not dump it all into one letter, but just kind of in a couple different digestible chunks of communication.
Amy, I'll just share too, like originally, like on our original 5-day-a-week return to school plan that was subsequently amended back on the 13th, one of the final communications we had on our administrative team, like internal planning documents, were all the things Bridget's referring to now. So those have been in preparation, in the hopper, part of the plan, and it was always the last thing we were going to send out. So it would be the first like top of mind issue that parents had before sending their students to school. You might remember back even further, way back to the beginning of the pandemic, we had talked about attendance-based incentives that we use throughout the district, where that might make sense in a lot of other years where we're trying as hard as we can to, to make sure but we're in a different spot right now. So that's another thing we've amended too, to make sure we've worked with all our principals to make sure, first of all, it's okay for people to, take a day, because it's about keeping the schools open for as long as possible. And as Bridget talks about, making sure parents have that information accessible to them so we can make good decisions. And our health rooms are ready to go, that we have expanded health room facilities ready, that we have the PPE we need in everybody's hands. So Bridget's been on top of that since prior to our meeting the 13th.
Yeah, and some of the updated guidance that's come from DHS and working with Darcy has been really helpful in answering some of the early questions we received from parents, which was like, well, what if my child has seasonal allergies? Or so are they automatically going home for a runny nose? And I think as we've learned more, which is Darcy has reiterated to us along the way that this is novel, we continue to learn more, but now the updated symptom guidance has really helped us answer those questions of parents, because they've reiterated on this list, it's 2 or more symptoms above baseline for that child. So it really kind of takes into account that there's going to be people with seasonal allergies, and it's just not one runny nose is going to automatically send a child home for 10 days. Right. And so as we've started to work on these criteria and collaborate with our health room staff and principals, I continue to enforce the notion that this is going to be collaborative decision making on attendance and when kids stay home between the principal, district office, the health department, and not just solely put on the shoulders of someone working in the office. But I think as our knowledge has evolved, it's helped us to answer what some of those early questions were we were receiving from parents midsummer.
One of the things that has anecdotally come up that I wanted to bring up while we were talking about it is that some parents in the virtual setting were getting letters home about missed classes in that first couple of days. And they were like, we just couldn't log in, and we're already getting notified that we're tardy or absent. And it's very stressful, to feel like you're failing when you're already struggling with just like the basic getting acquainted with things. So all that to say, I hope that we can figure out if there's any automated systems that are going to send stressful letters home to people when they miss class, when they've been advised to stay home, or figure out a way to pull some of that communication or soften it so that people understand that we realize that there are things that are going to come up and there's going to be symptoms that we're asking you to monitor, and that we don't kind of talk out of both sides of our mouth Like, it's okay to stay home, but here's your absence letter, you know?
Yep. So in a normal year, like having the automated attendance letter system up and running, right, is an important feature, right? But like benefit of the doubt and goodwill on missing something, like turning off the automated feature on the absence letters, right? That's in short supply, right? So I believe those probably generated either from a middle school or high school site. That would be my guess, where we use automated attendance letters linked to Infinite Campus. And if it hasn't been corrected yet, it'll be corrected tomorrow. So I see two people taking notes to make sure they keep my promises here. So, appreciate that.
Are we at a point where we can make a motion, you think?
So if we're through the discussion of this report and we're through questions of Darcy, right, I've made a couple of notes here on what people have discussed, right? There's a motion to integrate the latest information from the health department or anything else that others can think of, but I think we're at that time, Frank.
Yeah, so I'd like to move to direct district administration to amend the criteria noted, updating the use of percent positivity from binding to pervasive as a non-binding data.
Frank, do you want...
Is that a motion?
Yep.
Can I just ask a clarifying question here before we go any further? Do you want just the persuasive piece in your motion, or do you want everything in the health department's latest guidance integrated into our criteria?
I just read whatever 3 was, percent of positivity.
I'm sorry. And I had, I wrote those sample motions prior to hearing the new information shared with the health department. So I don't know if that encapsulates everything you want to do. I know that's certainly a part of it. So I just,
Can I
second that?
Oh,
now we can talk.
Discussion?
All right, hang on. Let me get the notes down for Jill later. So Frank motioned for 3 and Darren seconded. Okay.
Now there's discussion.
I appreciate the suggestion of amending the percent positivity to become a persuasive measure. However, I am prioritizing incorporating the full guideline document provided by the health department, which makes further changes than just the percent positive. So if there was room for an amendment to the motion, I would be willing to pose that amendment.
So just me talking out loud here, I see 2 things that the team and I would have to integrate into our criteria. That would be updating table 1 and table 2 in the rainbow color document that Darcy shared. And that means we'd be incorporating the critical region. We'd be talking about the table 2 criteria, which we currently meet. Sorry, somebody's got their mic on. That just exploded in my head. Okay. If Frank withdrew his motion and Darren withdrew his second, and someone moved that I direct district administration to incorporate the updated information that was shared by the health department this evening, what I would do functionally is I would amend our gating criteria to reflect this with both tables. And what that would functionally do is we would find ourselves in a place where we would be monitoring criteria for the next 2 weeks in preparation for a potential transition to phase 2 on the 28th. So that's if nothing changed and we didn't experience a dramatic boost that took us up into that critical area. But functionally, that'd be what I was doing. I'm sorry. Go ahead.
Could I ask a functional question under those circumstances?
Yeah.
So under the circumstances you just described, we would be moving into our 2-week period where we're ramping up for a phased return. Worst case scenario, Labor Day creates a shift in the direction of cases. We would have to go out of the high range in order to have to change to a fully virtual model again. And based on the table that I saw listed in the report, we have a fairly good amount of turnaround room before we would hit the critical area and would have to back out of that plan. So, yeah.
So
Okay.
that's Darcy nodding her head. That's the business manager nodding his head. And that is as I understand it too, because the criteria as it's written is we're tracking downward trend. So, and correct me if I'm wrong, please. Like we'd need a pretty significant change in the to shift the trend line.
Right.
So like if this is what all of you do tonight, like everything myself and the team are going to be doing from here on out is preparing for that last week of the month, that 28th, October 1st, kind of that week where I think Thursday is October 1st. Like Andy gets on the phone with Transpo tonight on his way home or first thing tomorrow morning. Like I redo the board report 3 criteria blocks so it's easy to communicate. I send a summary of this meeting tomorrow to our families in like I'll work tomorrow morning to make this digestible and understandable for everybody. The following day or day after, within 48 hours, Mr. Thielen's office shares what does phase 2 look like at a more granular level. That's functionally the wheels you all would be putting in motion.
So Dan, I got a question. To the motion, to what Leah was saying. So September 28th, we would go back to school?
So that would be
hybrid?
the first day of September 28th. If this is exactly how you want to do this, that would mean that first day of September 28th would be the first day of phase 2. If everything kind of continues in the direction we're looking at right now, right?
Would elementary be all in person?
So the first week, right, would be.
I know, I understand that.
No, it's a really good question because people are that's the first question people are going to ask, right? So the first week, that would be the blue and white days we talked about before for everyone. And then the week after that, it would be K4 through 5th grade full on. And we continue on that blue-white, like staggered schedule for secondary kids for the foreseeable future until our criteria allows a full-on change. So let me get my calendar in front of me.
Would that be 2 weeks after that then, hypothetically?
No. Let me do it one more time. Okay. So if you make these changes, right, on the 28th, right, all like blue families and white families.
Yeah, I understand that part, yeah.
Okay. So you'd be all lined up. And then on the 5th, right, the 5th would be that following Monday. That day would be the first day. Dan, am I getting this wrong? Are you ready to jump in? No.
I want to jump in with one other thing, but go ahead.
Okay, on the 5th, that would be the first week that all of our K4 through 5th.
Yeah, I understand that.
Okay.
Yeah, my question is 6th on to 12, K-12. When would their full days come back and virtual disappear? I know we got to follow criteria, but if we're doing 2-week increments, so say we start on the 5th, 2 weeks, 12th, 19th. So maybe by November 1st, full-fledged, everyone's in school that want to be in school.
Hard to say, Darren. And like as long as we have criteria.
If the numbers work.
Darren, we would have to move into the moderately high, the orange band, to be fully in place for secondary. Am I correct on that, Dan?
No.
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 No, you could do it.
We can go into yellow. That's what I'm saying. I'm reading.
No, like I know this is a challenging discussion, but it's very important that we get this right. So we should take our time here, right? So Darren wants to know exactly when 6th through 12th graders would be back to school full time. It's hard for me to project, and I hesitate to attach a calendar day as long as all of the board are stamping criteria here for us to follow. Because as soon as you put a date on something, like there's the date, it's there, and I don't know what the criteria you all have adopted is going to do. So it's hard, and I don't want to promise people that things that they plan their life around.
Right,
when I don't know what the holiday, for example, is going to do to the criteria you all have adopted.
Well, the data show. That's what I'm trying to say. After we figure it out, is it a 2-week increment that we're coming back to look at it, or are we just going to implement it once the numbers come down?
Oh.
We'll continue to update the dashboard, right, every week, right, with the number Darcy sends us, right? So once we trip the criteria to move into phase 3, we monitor that for 2 weeks, just like we're doing right now. Then we make the move. So, okay, I'm sorry, I was muddying up your question.
I've got a question too. I guess my main thing that I want to clarify is after Frank's motion is voted on and approved, hopefully, right now, the nuts and bolts of phase 2, do we meet those criteria right now today?
Yeah, I think we do.
Then why are we waiting?
Especially if I make this, I'm sorry, if we make these updates here on this document.
My question is, do we meet the nuts and bolts of phase 2 with Frank's motion in place? Then
For right now. Yep.
right. So as of today, does the school district meet the criteria for phase 2 based on all the charts and stuff we've got here?
Yes,
Then why are we waiting until the 28th?
because we said we needed 2 weeks to get the bus company and everyone on board.
That's more than 2 weeks.
He's right about that.
Right. To Mark's point, the 22nd, which would be 2 weeks from today, would be 2 weeks. I think when we were talking this morning, the 28th was a clean week. It's a Monday. It starts us a brand new week.
Right.
To start the entire hybrid model.
Right. You don't want to start.
Decision on the 28th. Again, a clean week for us to move forward with.
You don't want to start in the middle of the week.
I also want to be sensitive to families that made healthcare arrangement or care arrangements, all types of things that we originally said October 1st was the earliest that was going to happen. Could I argue even versus the 28th, we go to the 5th because we told families October 1st was the earliest it would happen. I just also want to be respectful of people that have made arrangements on the other side.
Well, I mean, if you're going to look at it that way, I mean, there's arguments both ways for childcare and everything. You know, there's people that are being really put out by having to pay extra childcare costs and everything else too. So, you know, that's the whole point. You know, the people that want their kids in school as quick as we can get them there, using all the standards and criteria that we got in front of us. So why are we dragging our feet? That's my question.
So there's also about 500 students, it sounds like, that left Edmentum because they could do the virtual now, because knowing that we were waiting until October 1st, right?
Right.
Or about that time.
Nobody knew we were waiting until October 1st.
In Edmentum, if we hadn't made that statement and said we would expect to be back by October, right?
I agree.
So I think we would be doing them a disservice by saying that we would go sooner. And I think I'm fine with the 28th date.
I am too.
If I could backtrack to one point that Mark brought up, and the first question he asked is, do we meet the criteria now? So it's important to note that the criteria the board voted on August 13th, we do not meet those criteria because we start at 100 plus is the high range.
Right.
That does not this. So for us to move into phase 2, this would have to be approved tonight, which is the updated metric, which has critical at that 350 band, would have to be approved. So to answer Mark's question, at this point in time, we do not meet the criteria as is approved by the board.
Not until you integrate this, like I was trying to explain before.
Another thing, Mark, you know, these teachers are doing virtual throughout the district. They got to get their classrooms ready also. To do virtual and get their classrooms ready at the same time, that's going to be a lot of pressure on the teachers just to get it all ready. Those extra 2 or 3 days can actually help them out.
You know, to all of that said, like we will push transportation, food service, and staff to accommodate whatever this board wants to do, right? And I think our people will rise to the occasion, right? So all that said, like we have good people who will work hard to execute the wishes of this board. So go ahead, Dan.
If I could just make one other comment, something that the board can consider as well, that week of September 28th, there will be no school on that Friday. It's a teacher in-service day.
That's right.
So
October 2nd is closed.
October 2nd. So I don't know if that plays into any of your decision-making, but I just thought I'd mention that.
Okay. So just to on the table right now is Frank's motion, number 3, seconded by Darren.
So we'll take a roll call. Jane?
But there's no, it's just.
I'm just focused on this. I have a different motion, but.
You can't hear you, Jane.
We can't hear you.
So I'm voting no based on, I would like to incorporate all the data provided.
And so Niglia votes no for the same reason.
Darren?
Data in the motion.
No, yeah, I'm doing each one separately.
It's not in his motion.
I'm doing it separately.
It is not.
Yes.
Amy?
No.
Leah?
No.
Mark?
Hang on. I'm sorry. Amy was a no. Or sorry, Amy was.
Yes. Oh, she was a no.
I was a no.
No, she was a no. Darren was a yes.
Mark, sorry. Yes.
And I'm a yes.
Okay. What did I miss?
3 to 4.
Got it.
3 to 4.
Jane, Cheryl, Amy, Leah, no. Frank, Darren, Mark, yes.
Okay. All right. Other motions.
So Niglia moves to approve I lost my thing. To incorporate all of the documents from the health department, tables 1 and 2. And also to include the use of the percent positivity from binding to persuasive.
One second. Table 1 and 2.
What's the start date?
I guess
September 28th.
September 28th.
Malat second.
1 second. Let me see if I got this. Okay. Cheryl Soniglia moves to incorporate all documents from the health department, specifically tables 1 and 2, and move percent positive from binding to persuasive, reflective of a targeted September 28th start date.
Right.
One question. Oh, hold on a second. You said second?
I did. Mhm.
Okay, so
We're in
discussion.
discussion.
So when you say targeted, is it a yes or no?
So
Well, it's
Frank,
gonna-
if the
I
criteria,
understand criteria. Right now we're meeting it. I'm just saying that.
right, but all I'm saying is that if there's a dramatic, as long as you have criteria, the criteria could change.
So we have
Right.
to go above 350.
The trend line would have to reverse from
Right.
From negative to positive.
Yeah, I get that, but I'm looking at this
Frank,
as
can I try to rephrase? Are you asking if we were to adopt this new criteria, the rainbow document, I'm going to call it,
Mhm.
would we be able to go in session, or phase 2, I should say? The answer would be yes, because we are well below the threshold of 350. So
Okay.
we would be allowed to enter phase 2
Mhm.
for this updated tables 1 and 2 metric.
All right.
Even
Thank
if
you.
the data trends up but is below 350.
Correct.
Okay.
Good.
Okay.
I'm sorry, I was saying that poorly.
No worries.
I've
Roll
got
call,
another,
Jane.
I've got another question.
Oh, I'm sorry.
Sure.
Go ahead.
No, go ahead. I'm sorry.
All right. Being that we're adopting table 2 as well, I mean, it's kind of redundant because you've already got, I mean, that there's stuff in 2 that really is taken up in other areas of the discussion tonight. So I don't know why why are we incorporating the metrics that are in table 2? The percent positivity, because we're eliminating that anyway to go to persuasive. And the only other things that's in there is cases trending downward in Oak Creek, and then the care for, if the hospitals are overwhelmed. So I don't really know that it's necessary to include table 2, because you're really looking at you're really looking at the criteria in table 1.
Yep.
Agree.
I agree.
I think it's in there because table 2 supplements table 1 by
Right.
allowing you to exceed 100 so long as the stuff in that lower table is met, which we do, right? It allows us to go from that 100 to 350 because these 3 other elements are met below it.
Yeah, the rainbow document refers to table 2 directly as part of its built-in phasing system. So without table 2, table 1 no longer functions properly. So it's a package deal.
Yeah, and as Darcy said, there's no perfect model, right, Darcy? It's just that it's highly recommended to continue using some form of data to make this determination.
Right.
So.
I feel pretty strongly, and we are an education, that's what we do is education. Education is based on data and based on science. So I think we have to use this.
Like I said, though, that's some of the stuff that's in the criteria that are in table 2. You're actually taking those out and you're making them persuasive rather than binding. So if you look up on table 1, assuming criteria in table 2 are met, well, the cases that are in Oak Creek, does that directly go back, or is that in the actual burden numbers that we're adopting already? And then the percentage of the hospitals that people in hospital care, that really doesn't have anything to do with it. So I mean,
yeah, it does.
The thing is, though, Cheryl, for the purpose of putting kids back in school, we're already taking the positivity number and making it persuasive. So those first two things in table 2 are kind of a moot point. You're going to watch them, but you're not going to use them as a binding criteria anymore. Therefore, you go to the second thing, or the third thing, which is the number of cases. That is part of the burden part of it that we're looking at already. And the last thing is number of people in the hospitals, which is a far cry from actually what we're trying to do with putting the kids in school. I mean, it's a part of it, but it's so far out. It's not something that is going to affect putting kids in school, I don't think.
So the care piece is in here in table 2 to talk to the severity of COVID-19. So should the severity of people contracting COVID-19 spike, that would be a persuasive argument into why you would want your disease burden to be lower. So for instance, if 100% of people getting COVID were going to the hospital and spending a week, 2 weeks, 3 weeks in the hospital, that would drastically change the way we would look at the disease burden or the amount of people getting sick over a 14-day period.
Right.
If that stays low, then the rate of severity stays low. You can, in theory, more people could be sick at any given time and we wouldn't burden the hospitals, or we wouldn't have such a severe reaction to it moving through our community. So the care piece is in there again to relate to the severity of the disease and is a persuasive argument into moving to a criteria up to 350 from 100 as the disease burden.
I have a question. To Mark's point, one of the statements in table 2 under cases says that Milwaukee County COVID-19 cases trending downward, Oak Creek COVID-19 cases trending downward, in order for us to move to hybrid blended model. Earlier when I asked, we have some wiggle room before we get to critical, before we would have to back out of our phasing model plan. But Mark has inspired me to look at this again, and now I find myself confused about whether a trend upward, even without reaching critical, would negate our ability to move to the hybrid model at the speed that we're assuming we would. So to summarize, if we start going back up at all, according to what's written here, it looks like it's saying then table 2 criteria are not met, and therefore hybrid cannot be the model that we move to. So right now, at this minute, we do meet it because we've been trending downward steadily. But if in 5 days we have, let's say next week's data actually turned around, what does that mean for this? Because we're no longer trending down.
Well, I guess the other question I would have as well is if we say table 1 is the data we have to rely on, and table 2 is persuasive, but table 1 requires table 2 data, we're taking persuasive data that is needed then for required data.
Right.
Darcy, do you want to answer Leah's first question?
Yeah. So, Andy, could you pull up the current burden graph? I think that's it right there. Yep. So that's a good point. If we did see cases start going back up, it would change the trend. But overall, the trend would, unless we jumped all the way back up to our, highest point, which was over 400, the trend would still be going down. It might be not be going down as steeply as it is right now. It might even out a little bit, but we would have to see a pretty large jump in cases in order to reverse the trend from downward to upward. Because at our highest point, we were at 400. So we're not just looking at this. I mean, when we talk about a trend, we're talking about a straight line, not the wavy line that changes every week. So we're looking at kind of the average. So if we put a trend line over this, you would see the trend line that would be trending at a downward angle. If next week it jumps up to 220, for example, the trend line, instead of being like this, it might go like this, but it would still be down because at our highest point, we were still all the way up at 400.
So Leah's earlier question from about an hour ago still holds true, that we would need a pretty significant climb, right, in our community burden to reverse this, right? Like we would need a dramatic uptick, similar to what we saw prior to around 4th of July.
Right.
Okay.
I wonder if the word trending needs a definition added to the document.
For some, I'm certain it will. Right, like you've all seen, like the level of data analysis, right, that any given constituent like applies to this varies dramatically. And I think some people are going to want every little bit of detail that we could possibly provide for ultimate clarity, right? And others will just want to know, like, is it going up? Is it going down? Did we meet it? Did we not? So, but when you plot a trend line, right, Darcy's plotting a trend line that reaches back to, how far does the trend line reach back? To March.
Yeah, we would
COVID.
have just one trend line, right?
Right.
So Darcy, to get the whole school district in person, you would have to be in green, correct?
Yellow, I would say, if that's what you decided. Yes.
If it could be physically distanced, yeah. Oh.
Right. And I think if you, I believe somewhere it says, the physically distance is right below the table, physically distance as best as possible given a school or district resources. So that's not saying we're going to come in with a measuring tape and measure 6 feet. It's just that, we're doing our best to implement the mitigation measures that we can in the environment that you have.
I.e. the kids in the virtual program, right? The mitigation measures we've been communicating throughout the summer, the amendment to the dress code masks that you guys passed prior. So.
Any comments?
So I guess I still had the question though, if we make the top chart binding and the percent positivity persuasive, is there an issue that our binding material or binding criteria assumes the persuasive data has to be in a given spot?
Is that a Darcy?
It certainly is more difficult to explain. Like, it's very challenging parsing all the language right here. Like the initial motion, like update.
That's why Frank's motion was the best of the whole thing here. Not to interrupt.
Frank's motion, as I understood it, was to just move percent positive from binding to persuasive.
Right.
That was my first motion.
So if we just went with Frank
Can I please just finish my thought? Right, I'm trying to keep this straight in my head. Like, I'm trying to do exactly what all of you are asking, but we're jumping on each other here. So Frank's first motion, to Mark's point, was to remove percent positivity from binding to persuasive. That did not allow me to incorporate this information. Right, and this information is critical to making the change as it currently stands because we haven't yet met the criteria you all adopted on the 13th.
Right.
So that's how I understood it. Maybe I'm misunderstanding it, but then Cheryl made a motion after that was defeated, and Cheryl moved to incorporate all the documents from the health department, table 1 and table 2, which to Jane's point, right, binding, right, but you need this for the wiggle room up to 350. So I suppose you could call that binding too, right? So Cheryl's motion said incorporate table 1 and 2 and percent positive from binding to persuasive, reflective of a targeted September 28th start date. So I don't know if that needs to be withdrawn or it can go forward. Like, what's the easiest way to clarify this to accomplish what the board's trying to accomplish? And what I think you're trying to accomplish is you want all of this incorporated, right? So that we're in this position to move into phase 2, reflective of the most recent and updated guidance from the health department, so that we can make the change to phase 2 as long as the trend line doesn't reverse itself. I think that's what everyone's trying to do. So my question is there a simpler, easier way for the board to accomplish that? Or does Cheryl's motion accomplish that? I just want this to be as clear as humanly possible for our families when I'm trying to communicate it.
Well, that's why I asked the question when I first started out, if we met the nuts and bolts checklist on to go to phase 2.
Right.
As of today, which is Frank's motion, but you said no. So where do we come up short, and what number do we have to hit to make it work?
You come up short with the 100, because 100 is the disease burden that is approved by the board as of August 13th, and currently we are at 162, so we are missing it by 62.
So if you just go with Frank's and say, move the percent positivity down, then we don't have to look at that. But then we're not adopting this new chart, which means we still go with the old chart, which said we have to be under 100 in order to get kids back into school, which is why we would want to update with Darcy's new recommendation.
Excuse me a second.
So
Unless you
essentially by adding table 1 and table 2, you're negating the criteria we adopted on the 13th. You're amending it, correct? So why can't you just amend it to a different number?
I can't hear you.
I said that we did provide a different number. We provided a whole table of different numbers as provided by the health department.
Getting back to Jane's point, yes, I was going to go with the positivity percentage. That was my first motion, but I had a second motion after that one, so that I was going to do to address this.
Would you like to share it?
Yeah, mine is I like to move our school district. I mean, I can tell you the motion if you want to. Is that okay? Okay. I move to our school district to move into phase 2 starting September 28th or 21st. One of those 2 Mondays.
Based on what?
No,
just move it based on Frank Carini?
So you don't want to look at any criteria at all as far as numbers in doing
that? I'm just looking at the elementary have to be fully in, okay? And I'm fine with middle school and high school being an A, B day to start, or whatever you want to call it, blue, whatever you said, A or B day. But I think, and then I was going to tell you that I would like to have on the agenda early October to talk about if we're going to go to phase 3 and how that looks like. Because we're never going to get to this green number. If you look at this, what is it, minus, what is it, 10 cases, minus or equal to 10 cases? Do you know how many weeks we would have to go to, and Darcy, you can tell me if I'm wrong or right, it would have to be like 1 case or 0 cases for weeks to get down to green.
3 cases.
No, it's more than that. It's less than that.
She said yellow could be.
I know yellow, but then you have to socially distance. We can't socially distance in the school district.
She said as best you can.
I get it. Okay, so even if you get the 10 to 50, 10 to 50, it's going to take weeks, could be even months before that comes to happen.
How do you know?
Cheryl, I'm out of respect, but numbers are numbers. COVID's not going to go away. We all know that, right?
Right.
And there's going to be jumps, and that the average is going to be like this. I just don't. I'm just telling my personal opinion. I just don't see that hitting the green and yellow number for a long time.
Okay.
That's just my personal opinion.
Darcy came to us already with new data from what we had before.
that.
You know,
Yep.
listen, because of the information that they had from her other people that she works with.
Mhm.
So what's not to say after studying this more that they'll do the same thing, that they'll come back with new data. So I think we
That's
have
true.
to,
I don't know that. We
Right.
don't know this. I'm looking at what I have today.
right, and that's why I think we have to go with what we have today. And if something else comes later on, then we have another meeting and we discuss it. But it has to be based on facts.
I understand that, but I'm just saying, and I'm fine if you guys agree with the COVID, but I agree with Mark, that 5 to 10% positivity, that holds nothing because it's an indicator. It's not, first of all, it's not even from the CDC. It's from Johns Hopkins University, right? And 3, the sample sizes are so small, we're never going to get that. What are we, a little over 6% right now?
6.5.
Yeah, to get under 5% and maintain that for a long time is going to be extremely hard. Every
Why
time
is it going to be extremely hard if we've already gone down 1.5% just last week? So next week we can easily go down another.
The lower you get, the harder it gets. It's just like trying to pitch a
Totally
perfect
reject
baseball
the idea
game.
that we're unable to follow this data. I think
No. Here's what I say, Leo. I'm fine with you guys. I agree with I'm fine because I want the doors open. Okay, if September 28th as it is, I'll go with it. Even though me personally, we do have to talk about when phase 3 is going to come up. And I don't want to wait till November.
I agree with Frank 100%. You know, the way everything's going and all the data is out there, it's always going to change, fluctuate. This is Oak Creek School District, Oak Creek Franklin School District, and the parents want them back in the school. I totally understand that. If we have a big outbreak, obviously us as a board, we're going to shut the schools down. We have to shut them all down or shut one school down. If you understand what I'm saying, the numbers don't speak for themselves when 72% of the parents want their kids back. If you want to go virtual, go virtual. That's what was put out there. That's what these parents have been complaining about since we made that decision. That us as a board did not listen to them. And I totally understand that. But hey, stop. I'm talking now. I let you guys all talk. We listened to Darcy and we listened to those numbers. And those numbers, like Frank said, he did the numbers. The numbers were correct. Now we redo the numbers. So we open up this right here to make it a little bit larger. So it makes it more feasible for us to go back to school. Okay, people want their kids back in school. A lot of mental anguish and stuff. A lot of stuff going on. Us as a board, we're protected. We're trying to protect our students and teachers and staff. I understand that 100%. But at some point, they got to get back to school. 18 and under, it was 71 people had COVID. None of them were hospitalized from what I'm understanding from Darcy. So for us to go ahead and open the doors, like Frank said, to start, with the hybrid on the 28th, AB, and then elementary to follow, same thing, but then the following week on the 5th, elementary full day 5, and then still AB until the numbers come back out. That makes 100% sense. 100% sense. Darcy, I know you did a lot of work into this, Dan. I know you guys at the administration. And we really appreciate that's why we're here talking. That's my personal belief. That's how I feel.
I have a suggestion that I think might help us all come together. So the comments in table 1 where it says assuming criteria in table 2 are met. What if that statement was amended to say with a careful consideration of the data reflected in table 2 as a persuasive metric for moving forward?
Say that one more time. Sorry.
I don't know if I can. I said, what if we amend the quote, I'm going to quote the area of the table where it says, assuming criteria in table 2 are met, which to me is the statement that I think Jane and I are agreeing on that sort of makes it seem as though table 2 becomes required data instead of persuasive data, since the word assuming is used. And we've already agreed that the data below is really persuasive data. It's not hard numbers even provided anyway. And we all have come to an agreement that there's some flexibility in the positivity rate as a hard line number. So what if, instead of having assuming criteria in table 2 are met, we amend that in table 1 in our proposal as a board to reflect that with a close review of the persuasive data provided in table 2.
Okay, yeah. I can't hear
I
you,
don't think
Mark.
you're on.
You're not on, Mark.
All right. That's why I started out the argument, because if you look at our phase 1 and our phase 2 criteria for putting the kids back in school, with Frank's motion, it took the binding criteria for positivity and made it persuasive. All right. So the nuts and bolts of putting our kids in school are already covered by taking and switching it to persuasive. All right. So these tables, whatever's in these tables, is an addition to our actual phase 1 and phase 2 criteria for getting our kids back in school. So everyone understands that, I hope. That's why I said the table 2, it's redundant information, because as soon as Frank's motion is adopted with making it persuasive, whatever's in the first 2 things in table 2 will become a moot point, because they're already part of our criteria for putting the kids back in school. And you're adding another table in that says the same thing you changed, or tentatively going to change in the rules to put the kids back in school. So the only thing you'd really have to do is get rid of table 2 and take, because it's all, the persuasive part of the criteria is already in our rules for putting the kids back in school with phase 1 and phase 2. You're changing that. All you'd have to do is strike that assuming criteria in table 2 are met. You get rid of table 2, you adopt table 1, and just take that assuming part of it out, because you're not using table 2 anymore anyway. That's what I was trying to explain before. Table 2 it's just redundant language. It muddles the whole thing, because you're changing already in the actual phase 1 and phase 2 going back to school rules. It's changing it already. So whatever's in table 2 is already found in our rules for putting the kids back in school. It's
But we're
already there.
amending those
Everything is there.
rules with this decision.
It's all there. Table 2 is a moot point. You don't need it. Just strike that language in that one box right there out of table 1 and adopt table 1, and you're done. It's finished. Go look at the criteria for phase 1 and phase 2.
So I'm sorry.
It's all right there.
So Leah and Mark just functionally said the exact same thing.
Don't use table 2 at
Is that
all.
what it is?
Don't use table 2 at all. Just adopt table 1 and strike that language in one box.
I think I'm following you. I'm just trying to dispassionately restate it so we can all understand, right?
The orange box, Mark.
It's important to note that we still have a motion on the
So,
table.
I'm sorry. I'm keeping track of the motion on the table. Can I please just sum this up? So Frank's original motion to strike percent positivity and Mark's current discussion regarding adopting table 1 is basically the same as what Leah and Cheryl have been describing. It just is clean. Leah's nodding her head yes. Are we on the same page?
Yeah, I think.
Just adopt table 1 and strike the language in that one
Yeah,
box.
I think that what Mark just handed me was the copy of phase 2
Right.
as it's currently written.
Yes, which includes what Mark's talking about in table 2. Got it.
It incorporates that under the persuasive data column anyway.
Got it. So everyone's right, and we're all saying the same thing in slightly different ways.
True.
Good. So just for clarity, right? Just for clarity, the cleanest way for me to write this up would be for Cheryl to withdraw her motion and for Amy to withdraw her second, and thus to go all the way back to someone moving the 1 and someone adopting the table.
Yeah, you'd have to go from binding to persuasive on the positivity.
Yes,
And then
Frank's
you'd have
original
to say,
motion.
But we're going to adopt table 1 and strike the language in that one box. That's all.
Because it's already in our other criteria.
Yeah, because it's already in the criteria in phase 1 and phase 2.
Can I say that again, Darcy? Does that make sense?
It's in phase 1 too. Right there is phase 1.
The only thing I would say is in the original document, it talked about percent positivity as 5%. And if we're moving that down to whatever, this actually gives us more room because it says 5 to 10.
Right.
Yeah, you're making it persuasive instead of binding. So you're just looking at it. You're not going to
Correct. But if you said just leave it or just move it to
just use Frank's motion and then upgrade Cheryl's motion to adopt just table 1 instead of table 1 and 2.
right, but Frank's motion was just to make positivity persuasive, which was at 5%. Darcy's now saying 5 to 10. I'd like to adopt 5 to 10 as persuasive to give us as much latitude as possible.
You're asking for the same thing. You're all asking for the same thing. We just
If
have
it's
to slow it
persuasive,
down
it
and do
doesn't
it
make
that
any
way.
difference what you strike it at because we're just using the information as other information. It's not binding anymore.
Okay, so we're all kind of there. So can we withdraw the motions on the floor and start again?
Okay, so Niglio will move to withdraw.
Malat was moved to withdraw her second.
Now give me 1 second to update my notes. Okay, now we're back to 0.
Yep.
Okay. All right.
Frank.
So who would like to make, Frank, you're the president, you call for a motion. I'm sorry, I'm just trying to get my notes right.
Can I do my first one then?
Yep.
You're not on.
Thank you. Can you hear me now?
Yeah.
Okay. I have a motion to move our, excuse me. I have a move to direct district administration to amend the criteria noted above, updating the percent positivity from binding to persuasive.
Grabowski seconds.
All right, I have, sorry, who's got the second?
Darren,
Darren.
now's your discussion.
Okay, 2 questions. So, Darcy, by changing any of this, are we changing anything in the box itself, the wording? And I guess, does this document, Darcy, did this come from, is this something you created, or is this something that your cohorts of public health officers devised?
Yeah.
The rainbow one.
Yes,
Right.
we jointly developed that.
Okay.
Frank,
So
you got it.
do you have any issues with what we're proposing?
I mean, these are the recommendations that I have, but you guys as a school board certainly can do anything that you want that you feel is best for the district.
I think Mark wants us to take out assuming.
Do you see anything of what we're doing that would be disadvantageous to our students or to this process? I don't want to hurt anything.
No, I think the challenge that I see is it seems if you're removing that reference to table 2, that, there's no difference between the orange and yellow levels, and maybe that's what you want.
Right.
But that would be what I would see as the impact of that.
Just to clarify, Darcy doesn't have the phase criteria in front of her. And to Mark's earlier point, oh, you do, I'm sorry. Because I think the point that Leah and Mark were trying to make was that the phase criteria we have that we're not altering is functionally the same as what appears on this document.
Okay.
Darcy's looking it over. Did I say that wrong, or is that just trying to sum up the statements that have been made here?
So you're using, I mean,
Let me put my 2 cents in here again.
Okay.
To Frank's motion, I think you have to incorporate table 1 and take out that language that's in the orange line, that assuming language, because you're not adopting table 2. So any reference to table 2 has to come out of table 1. But in order to make us legal, like we were talking before, in order to make us meet the criteria for phase 2, we have to adopt this chart, correct? That's what everyone was telling me 5 minutes ago. So that's why I said we can adopt table 1, just strike the language here on the end, assuming that it makes the criteria for table 2, because we're not using table 2. So what you'll have to do is, I believe, you'll have to amend your motion again to make the take the positivity to persuasive, but then we're going to use the criteria in table 1 and strike the language in that one little box, and then you'll have it. It'll be done. Because you have to have the criteria in the rainbow thing to make it so we can go back to school for phase 2, because just a regular thing like you guys were telling me 5 minutes ago won't get it done.
Mark, just to clarify, that exists in 2 boxes. The last box in the orange and the second last in the red.
Okay, that's the places the language will have to be struck out of there because you're not referring table 2 anymore because you're not using it.
Yep.
So we're using everything on table 1 except the reference to table 2, because everything in table 2 is already in our phase stuff. When you look at the phases here to go back, all that stuff is in our phase criteria already.
I stand by my statement earlier that suggested that we have some kind of indication that that column is different from the column to the left of it through a close review of the persuasive data on the phasing list. Because otherwise what we're basically saying is that hybrid and in-person under moderately high are the exact same circumstances.
Right.
Same thing for in high to red. If we just totally get rid of that language, we're saying that those 2 columns are the exact same circumstances.
Yeah.
And what I would recommend is that we utilize the hint that the health department has provided that that column is in fact a different level of consideration through some kind of formal calling out of a close review of the persuasive data aligned.
Right. I like that. That makes sense.
We got a motion on the floor right now. Frank moved number 3 and Darren seconded. So they can either withdraw their motions and we can try to clarify this, or Frank can call for a vote.
Well, that goes back to my question before on the nuts and bolts of our phasing thing. With just Frank's motion, are we going back to school on the 28th? And everyone in here told me no if we don't adopt this chart.
Right.
That's why I said you got to adopt table 1 minus the language in this box and this box because you're not using table 2. You just adopt table 1 minus these 2 spots with that language referring to table 2, and you got it all done. You got all the criteria you need to go back to school, and you're not using the reference to table 2 because you're already changing it to persuasive in the phasing language.
And
So
then
you
Leah,
don't
and then Leah was saying that then there's no differentiation between the yellow and the orange. So she's just saying if you change it to
No.
It's
Can't hear you, Leah.
hybrid and in-person in the orange is what Leah's saying, and then virtual hybrid in red.
Yeah, I'm not pointing out that there's no difference between the colors. I'm pointing out that there's no difference between the columns. Specifically under red, there would be no difference between providing virtual and hybrid. And in orange, there would be no difference between physically distanced hybrid and physically distanced in person. And what I appreciate about this table is that it shows that as you move right along the page, you need additional scrutiny of criteria.
Right.
To be able to move in person or, right.
Right.
But if we move my motion out there, it doesn't really matter because it's persuasive. It's not binding anymore. Correct?
Right. For that part of
So
it.
Mark, your point, I don't think it matters really anymore because if it gets passed, that positivity rate is really not held accountable like it is with the 14, but what the burden rate is basically. It's a guidance. It's out there as a measure, but it's not really part of it. It will go into the numbers, trust me, it will go into the numbers of the burden rate, but it won't hold you accountable basically.
Right.
If you want
Okay.
to,
I get it.
choose,
I get it.
that's what I'm saying.
Could somebody reread the motion just for clarity?
Yes. I had a motion to basically to move direct administration to amend the criteria above, updating the use of percent positive from binding to persuasive.
But not adopting table one.
Yet. They're doing them in separate motions
doing two
for
separate.
clarity.
Okay.
I was doing two separates, and then Cheryl did both into one, basically.
I got it.
It's just
Okay.
cleaner this way for
I just think
reporting.
it's better to go by
note-taking.
steps.
All right. I wasn't clear on that we were doing two separate.
You don't take Mark, it doesn't matter.
All right.
Okay. On the table.
Okay. Roll call.
Wait. I'm sorry. I'm totally confused. Are we doing? We're going back to your original motion?
Yes, and then we're gonna do another one.
We're going to do a second one?
So it's
Okay.
not, so it isn't all baked into one because I had the longest, most convoluted 3 semicolon motion that nobody would have understood written first. So I think they're breaking it into pieces. Okay.
Yeah, we weren't really aware of that, so that's why the confusion.
That's why I wanted to do in pieces, but I understand why Cheryl did
No,
it. I understand.
and that's fine. There's a lot of people talking and like it's late. There's a lot going on. I'm glad it's all clarified. Yep.
Okay, roll call. Jane,
Yes.
Cheryl,
Yes.
Darren,
Yes.
Amy,
Yes.
Leah,
Yes.
Mark,
Yes.
and I'm a yes. Okay, so that's non-binding anymore. That's moved down. Good. Okay, just want to make you guys know where we're at. So I'd like to move to the school district to move to phase 2 starting September 28th.
Don't you want to do the table first?
You got to do the table or you won't make it.
Sorry. I'm just excited to open the door. Sorry. Does someone want to make a motion on that?
Cheryl, go ahead.
Okay.
Good.
So Niglia moves to adopt table 1. And
But you have to take the criteria out that references 2.
okay, then we're taking the criteria out for table that references table 2.
Yes.
Correct.
Now you got it.
I mean, is that? I can't hear you. I can't hear you. Sorry.
Am I allowed to feed her motion? Yeah. I don't think so.
Cheryl,
I-
Cheryl, could you withdraw your motion?
I'm going to
and then
withdraw.
we'll
'cause
start
I-
again.
Right. Leah, go ahead,
Okay.
Leah.
Shriver Johnson will move to adopt table 1 as binding criteria for phasing in of our school decision.
Sorry.
Phasing in of schools. I don't.
Leah moves to adopt table 1 as binding criteria for the phased reopening of schools.
Thank you. With a change to the wording, replacing the phrase, assuming criteria in table 2 are met, with the phrase, let me know when you're ready, Dan.
With a change to the with a change to the phrasing, replacing
Assuming criteria in table 2 are met, in quotes. Replacing that with
You don't have to replace it with anything.
yeah, you do. Replacing it with close consideration of persuasive data required.
So Niglia seconds.
Discussion? Technically, I'm just going to say a comment here. Technically, the positive percentage numbers are going to be put into the burden rate anyways. So I don't know why, I'm just saying, I don't know why we have to tie that in there
Yeah.
technically. That's all I'm just saying.
Yeah.
I do, I got a question about, did you say September 28th?
No,
Okay. You're just talking about the table.
correct.
The first motion didn't have the 28th.
and so if you're adopting criteria, the criteria dictates the date. As I understand the use of criteria.
That's why I asked.
Because if you put a date in there, right, the date and the criteria could potentially contradict one another,
Right.
right? So like if you adopt criteria, we talked about what that functionally does, and it functionally results in the 28th, given current conditions.
Right.
Well,
So
it doesn't,
sorry.
right?
If
Doesn't-
nothing changes.
Well, this says 14 days. 14 days from now is before the 28th.
Mm-hmm. So 21st.
So if we want
This is
the
a minimum.
28th
Minimum of 14 days.
Sure, but that does create a complication for the idea of when we open, if we want to use this meeting to select the first possible opening date.
That could potentially be very helpful for organizing things.
Understood. My motion's already on the floor, correct? Because I believe Amy seconded.
No, I did.
And if I could just read it out loud, so we're all in the same place, and I make sure I have it right. Leah's motion, as I have crudely transcribed, reads: LSJ moves to adopt Table 1 as binding criteria for the phased reopening of schools, with a change to the phrasing replacing, assuming criteria in Table 2 are met. Replacing that with close consideration of persuasive data required, in quotes.
Yeah.
So I got a question. Are we still in discussion?
Technically, that's already in the phase 2.
Yeah, why do we have to do table 2 is met?
That's what she just said.
Yeah, she's taking it out, but
Okay.
It's taken out.
Just want to confirm. Okay, thank you.
like only thing just one more statement before we vote. By passing the first motion that Frank had on the floor, we took the positive from binding to persuasive. Correct? Everyone agrees on that. All right. Now you don't need it in here anymore because it's already in our phased language to go back to school. That's why all you got to do is strike it out of this, strike it out of here, because it's already a consideration in here to go back to school. You don't need it in here again. Just strike the language and have it over with. Clean it up.
The motion's on the floor.
Yep. I call the question. So Niglia calls the question.
And no more discussion? Okay. Roll call, Jane,
Yes.
Cheryl,
Yes.
Darren?
Yeah.
What? Yes. Okay, thank you. Amy?
Yes.
Leah?
Yes.
Mark?
A really reluctant yes.
I got one. Oh, forget it. Okay, no, it's fine. Yes, sorry. I'm a yes.
Okay, unanimous, 7-0. Okay, other motions.
Frank, if you want to make a motion to have the first possible date, this is your chance.
Oh, yeah, trust me. So I have a motion to our school district to move in phase 2, starting September 28th.
Grabowski seconds.
Discussion.
I don't like that motion because it basically throws away the table we just put together. If you change the wording slightly to say first possible based on criteria being met is September 28th, that is something I could get behind. The way that it was worded basically threw away the criteria.
So my only question is, if I look at this data that we just passed, we met everything right already. So why are we waiting 3 weeks?
Yep.
Because
that's why I asked you why we're waiting 3 weeks before.
Because we need 2 weeks to
No,
get
I get it.
everything set.
I understand that. So getting back to, so if we're waiting, we can do 2 weeks, which is the 22nd. Then the 28th should be a no-brainer.
The bottom of table 1 though says metric indicators should be at a threshold for a minimum of 14 days. It does not say 14 days. It does not say 21. A minimum of 14.
Yeah.
So anything the 22nd and beyond would suffice from the data because
I
we
know.
currently meet the metrics that were just approved in the Rainbow document.
And I'm fine, Andy, with the 28th. That's why I put it out.
Yeah. No, I'm just stating that we meet that with saying the 28th meets the minimum of 14 days from the board approving this, and we meet the metrics of the Rainbow document that were also approved.
Today.
Right.
I don't disagree with the date, actually. My problem with the motion has nothing to do with the date that you selected. I think it's a very reasonable date and it's one that I could get behind. My problem was that the motion did not make any reference to the data we just passed as opening criteria. That's the problem.
So she's saying the motion you made makes
I
it
know, I
sound
get
like
it.
no
I get
matter
it.
what we
I
don't put
just
on the
assumed it
28th.
was like after the table one we just voted on, but.
Okay. So do you want to withdraw your first and Darren withdraws his second? We go again?
It's fine. I withdraw my motion.
I withdraw my second.
Okay.
So then I make a motion for our school district to move into phase 2, starting September 22nd, following the table 1 recommendation.
Did he change it?
Yeah, he changed it.
Sorry. I'm sorry, Frank. I
I'd like to second
apologize.
that. But you're saying the 22nd, Frank. Do you mean the
I thought, did I
28th?
say 22nd? I'm sorry.
Yeah.
I meant
you
the
did.
28th. I'm sorry. I'll rescind it. Sorry. I'll start over. Sorry. I move to get our school district to move into phase 2, starting September 28th, utilizing and the recommendations based on the metrics on table 1.
Grabowski seconds. But you're missing, from what Leah had already motioned. You're taking her motion into the thing that we voted on.
Yep.
To your motion.
Correct.
Because then you ain't got to worry about the assuming and all that other stuff.
Can I confer with the lawyer on the wording of this motion?
Please.
I would just like her feedback on whether that wording is correct for the intent. I understand what his intent is and I agree with the intent. I just want to make sure that the motion wording is meeting that.
Dan, can you reread the motion that you have written?
It's exceptionally challenging to keep up with longhand, given how quickly people are seconding and launching into additional discussion, right? So what I have in front of me is 3 draft motions trying to encapsulate the exact same concept that I believe everyone agrees on, which is Frank moves to move into phase 2, September 28th, utilizing the metrics adopted in the prior motions.
Yeah.
So the concern I have with the language is exactly what you mentioned, Leah, that even though it references the criteria that the board has just adopted in the prior 2 motions, it seems to suggest that September 28th is going to be the opening date. Right.
So might I make a suggestion? So could I suggest, and if I'm out of bounds here, someone please correct me, we adjourn for 5 minutes or take a brief recess. I'd ask Frank to coordinate with Chrissy on writing a motion that exactly encapsulates the intent that is desired, come back after a quick break and do it again.
I'm fine with that.
With the motion on the floor, though? Isn't there a motion on the
We
floor?
would have to withdraw the motion on
Okay.
the floor, which
Thank
we could
you.
absolutely do very easily, and then we could come back and work this out.
I withdraw the motion on the floor.
I withdraw my second.
Now I'd ask someone to call
I'd
for
like
a
to recess
10-minute
for
break.
5 minutes.
5 minutes.
So Niglia calls for a 5 to 10 minute break.
5-minute break.
Grabowski seconds the 5-minute break.
Okay.
Do you need a roll call, Frank?
I guess simple all in favor.
All in favor? Frank?
All in favor, say aye.
Aye.
Opposed, say nay. Okay. 5-minute break. Thank you. moving forward is I will not put forth a motion, but would request that the minutes reflect that based upon the prior motions adopted by the board, establishing the criteria for a phased reopening of the district schools, that the target reopening date will be September 28th, assuming the criteria adopted continues to be met.
That's fair. Can't hear you.
Okay, so as we draft up the minutes and as I share or direct the sharing of subsequent communications based on the board's actions tonight, the targeted date in the minutes will reflect phase 2 transition, given everything Frank just mentioned, with that date reflected in those minutes. Everybody's good.
Yeah.
All right, substantial agreement.
Yes.
Before we motion to adjourn, I just thought maybe if you guys want to go around the room and have final thoughts. Jane?
Oh, geez, trying to sum up the last 3 hours. I think I have always said I wanted to use some type of science, some type of metric, so I'm happy that we are still doing that. I am happy that we have also continued to look at what those metrics and thresholds are. I'm excited to get kids back to school safely.
Carol?
I too am happy. Oh, there we go. I too am. Can you hear me?
Yeah.
I too am happy that we are using metrics and science, especially in an education-based society that we are. Thank you to Darcy and the health department. You are a great team member, and we're grateful that you work so hard with us. And I too want to get our kids back to school and our staff back in, back and as safely as possible.
Darren?
Hats off to everyone in this room coming together. The vote showed that 7-0 twice. Really appreciate all the hard work administration has done, Darcy, for your support with them, and our virtual learning with the teachers doing that, what they're doing right now. Awesome job. This has been going on since March 13th. It's probably never going to end, but we got to start somewhere. We're getting these kids back in school, and I'm appreciative of everything everyone's doing.
Amy?
Yeah, and I just thank everybody for answering all the questions I came with tonight. I know I had a lot of questions coming in tonight. I had gotten a lot of emails, obviously, from everyone with a lot of questions, and wanted to make sure that all of those questions were addressed in our meeting tonight, and I'm pretty confident that they were. So I just appreciate this board coming together and continuing the conversation, and I have a feeling we'll have to revisit this again at some point again, because phase 3, who knows when that's going to happen. So. But I appreciate everybody's input and the questions tonight.
Leah?
Yeah, I would just reiterate how proud I am of our board for continuing to work together. And, we might have to work through some details here and there, but I think in the end, we all have the community of Oak Creek and all of its different pieces and parts in our minds and hearts, and are always working to make decisions that will suit as many folks as we can under hard circumstances. So I just really appreciate the teamwork, and thank you so much to our administrative leaders for the very long hours and very sleepless nights that I know you're all experiencing. And we just, it's hard to show it as much as we can and should, that we really appreciate the hard work you're doing. And thank you so much to Darcy for being here and helping us navigate these very murky waters. We really appreciate your expertise and professionalism through it all.
Mark?
Well, I guess I'd first like to thank our superintendent, Dan Unerdl, for all the hard work and behind the scenes running and trying to get everything coordinated with the school district here. I think everybody in this room realizes he's had a lot of stuff on his plate for the last 3 weeks or 4 weeks. Not only with getting kids in school, but we've got a lot of new administrative staff here, and it's been a heck of a job, and I'm glad we have the right guy in place to do it. Kudos for Frank for kind of grabbing this thing and moving it forward along with Dan as well and Darcy as well. But the people I'd most like to thank, I think, are the families of Oak Creek for being patient enough to give us a chance to get this thing done right without, having, protests and stuff going on here at the school district every day and taken away from the mission we wanted to accomplish. And thanks for everyone's patience. And I hope everything turns out and we get a good school year out of it. And kudos to everyone going forwards.
Yeah, I agree, Mark. I echo your comments. I thank, to all the parents, families for all your feedback, your emails, phone calls, your patience, extremely long patience. I was a big fan of bringing him obviously back into school, but I knew we had to make some adjustments here. But I would like to put on the agenda that on our agenda's updates on this. Starting next week, Monday, we have a meeting, right? But I'd like to have a conversation early October, even looking at the numbers and discussing the phase 3 opportunities as we go on. I know we just adopted the table 1, but those conversations can come forward also. I'd like to thank I'd like to thank Dan again for all the hard work, all the administrations, everybody working so hard. It's a lot going on. There's a lot of balls up in the air, but I think we moved on this quick, and so I wanted to make sure that we get these kids back and get our doors open. So again, thank you, everyone. And do we have a motion to adjourn?
So Niglia moves to adjourn.
Eichhoff seconds.
Any discussion? All in favor, say aye.
Aye.
Opposed, say nay. Have a good night, everyone. Thank you.
Good night.